Testing, testing. How are we doing, staff?
The recording studio is having an issue getting the feed into the room, so they are trying to fix that right now. So just give us a couple of minutes and we'll get started. Mr. Chairman, can you please test it?
Test it in terms of I'm speaking.
Just say some things and then they can see if it works.
Okay, I am speaking. Hello, for those of you in the room. Can you hear me? Can you hear me?
We can hear you, sir.
All right, so it's working now?
Yes, we can hear your audio and we see your video, sir.
Yeah, but it was the people in the room that were the issue, not me. Is that someone in the room saying that?
Yes, I'm in the room, Mr. Chairman, and we can hear you.
Okay, so we're all set again, maybe?
Yes, sir, we're set to proceed.
All right. Recess is over. Okay, back to where I was with a brief opening statement. I mean, obviously, our nation has been tremendously challenged over the last months. COVID has disrupted the entire fabric of the country. Hopefully, we're beginning to move toward a recovery phase, which would come with an infrastructure investment to put people back to work. But we also now have the challenge of what's happened, the murder of George Floyd. And the House Democrats introduced a bill yesterday. It's being heard tomorrow, and it'll be marked up next week. And I expect the week after next, we will work on substantial justice reform in the House of Representatives. And then the following week, we will be taking up an infrastructure package and perhaps other bills. I'm not quite certain what all those might be. We're hearing today from one of, obviously under our jurisdiction, the most impacted sectors of the economy, those who work in transportation, both in terms of the economic impact, the loss of ridership or paying passengers in the case of aviation, the challenges to trucking. Certain sectors are incredibly busy. Other sectors have been devastated, particularly those who deliver automobiles and some other sectors. There's questions in all sectors about personal protective equipment and other measures that need to be taken to protect transit workers, aviation flight attendants, pilots, passengers on airplanes, passengers in transit, rail, Amtrak. I was talking to the new president of Amtrak yesterday. Their revenues are still down over 90%. So we have many challenges across many sectors. Maritime has been impacted, certain sectors.
I'm in.
Okay, perfect. All right, sounds good.
Okay, good. Mike, mute, please. Thanks. And I want to hear from the folks on the front lines today, how this is impacted, what measures have been taken, what's working, what isn't, what further measures need to be taken. Can they be done voluntarily? Do they need to be done with federal direction, either administratively or legislatively, to keep workers and passengers safe, to keep freight moving in an orderly way, to help restore the economy, and other challenges. So with that, I would defer to Ranking Member Graves for his opening statement. Sam?
Thank you, Mr. Chairman. I appreciate it, and I do appreciate your willingness to conduct today's event as a hybrid hearing. I think it's important to allow members who want to participate in person the option to do that. And at the very least, we ought to be able to figure out, and I think we have at this point, figure out the technical issues when it comes to the committee hearing room itself. It's important to understand just how, as you pointed out, just how this coronavirus pandemic has impacted frontline transportation workers, so we can continue, so we can determine at least a path to a safe recovery. And the pandemic has, it's ravaged our country with entire sectors of our economy coming to a screeching halt. And I'm sure we all hope that last week's better than expected jobs report is the beginning of the recovery, but that still remains to be seen. Throughout this pandemic, many workers have continued to show up and put in a hard day's work. And just like the overall economy, different sectors of the transportation economy has been impacted in different ways by coronavirus. But many of the essential workers in the transportation sector are still doing their jobs. So moving forward to recovery, we have to make smart, safe, and calculated decisions to get our workforce going and businesses hiring again. And this is going to affect our ability to restart and reconnect supply chains that are absolutely key to any recovery. As Americans, as we get back to traveling, we need to be safe and use effective measures to give us the confidence we need to return. But we also have to ensure that the workers that provide these transportation services that they're safe. And I'm glad to have the opportunity today to hear directly from frontline workers about their experiences during the pandemic. And thank you for participating, all of the witnesses for participating today. But more importantly, thank you for keeping our economy moving, even in some very, very difficult times. And finally, I do want to add, as everybody else has added too, it's incumbent upon us to make sure that we mute and unmute ourselves throughout this process. But with that, I yield back.
Thanks, Dan. I appreciate your statement. With that, I will move on to witness. The first witness will be Larry Willis, President of Transportation Trades Department of the AFL-CIO. Mr. Willis, unmute with your statement. Someone else needs to mute. Please. Okay, go ahead.
Thank you, Mr. Chairman and Ranking Member Graves, for the invitation on behalf of our 32 affiliated unions and millions of frontline workers that are represented by those unions for the opportunity to be here virtually today. I think it's an important hearing. I want to thank you, Mr. Chairman, and Mr. Graves, for the kind comments about our members and the role that we're playing during this pandemic, and Mr. DeFazio, for your leadership and members of this community in the CARES Act and the CARES Act, other things that have been done to speak to this both public health and economic crisis. Our members, they operate and build transportation networks that bring people, goods, and critical supplies to every corner of our nation. Whether they work in aviation, transit, rail, commercial bus, construction, or long-stored maritime sectors, they are essential by any definition of the word. As COVID-19 has spread across our country, many of these workers have continued to perform essential duties, often at great personal cost. I'm talking about transit workers who have continued to drive buses in the face of the pandemic, despite hundreds, if not thousands, of deaths in this sector alone. Longshore workers who continue to load and unload vessels in close quarters. The freight rail workers who forge ahead, even as carriers slash workforces that are already dangerously thin. Pilots and flight attendants who are some of the first U.S. workers exposed to COVID-19 that were not given the right tools they needed to protect themselves and their passengers. I'm also talking about those who have lost their jobs as our economy has ground to a halt, are unsure about when their next paycheck is coming, and now find themselves without health care during a pandemic. Since the beginning of this crisis, transportation labor has prioritized the safety of our nation's frontline workers. We called for appropriate PPE, workplace sanitation and cleaning procedures, and proper social distancing policies at work. Despite these repeated calls for action, this administration and far too many employers have failed to provide timely or appropriate responses to this virus and have flat out refused to act. In this stunning absence of leadership and quick action, it has been working people and their unions to sound the alarm and use our collective power to make change.
Please mute.
But a crisis,
Go ahead, Larry.
but a crisis of this magnitude demands a national solution. Congress must act decisively and with the full authority of the federal government. For transportation workers, this means enforceable, modal-specific rules that we know will keep our members, passengers, and their families safer and better protected. Many of the mandates we have called for were included in the HEROES legislation recently passed by the House and should be expanded to cover our broad and diverse transportation system. We also support the Every Worker Protection Act of 2020, which would require OSHA to issue an emergency temporary standard within 7 days. By adopting these measures, Congress can make a real difference in the lives of frontline transportation employees and all workers. Your job, however, cannot end there. The economic impact of COVID-19 has been devastating and will reverberate years beyond the immediate healthcare crisis that we are in. Congress must use every tool at its disposal to mitigate the hard times ahead, including bold federal investments in our transportation network. Public transit needs billions more to maintain critical services and avoid job cuts in communities across the country. Amtrak reports is expecting a 50% cut in riders into next fiscal year and plans to furlough up to 20% of its workforce, a plan that must be rejected. The closure of school facilities has resulted in the loss of employment for thousands of school bus drivers, mechanics, and other employees. Slowing cargo volumes threatens the viability of the U.S. maritime industry. Stipends for vessels enrolled in the maritime security program should be increased. Air travel, as mentioned, is down over 90% compared to last year. And while the CARES Act payroll grant program did an excellent job of preventing immediate and massive cuts in this sector, we know that the airline industry remains in an extremely difficult and challenging financial position. We also know that investing in infrastructure creates and sustains good jobs in construction, maintenance, operations, and manufacturing. What's more, when we improve the quality and accessibility of our transportation network, the economic opportunity of those investments extends to every corner of our economy. From businesses who can move goods quicker and more reliably to workers who can reach new opportunities because of improved highway and transit access. Finally, we cannot ignore the fact, especially given the times that Chairman DeFazio mentioned, that communities of color have been disproportionately impacted by this crisis. We must understand that this did not happen by accident. It is the direct result of systemic racism that has plagued our nation. While one hearing, one speech, one piece of legislation cannot unravel generations of oppression, change can start today, right now, with all of us. As lawmakers, as labor leaders, as workers, we must all see racism and racial injustice for the disease that it is, and seek and implement solutions that uplift and support our Black, brown brothers and sisters. And say with conviction, Black Lives Matter. With that, Mr. Chairman, thank you again for the opportunity to testify.
Thank you, Mr. Willis. Next, we'll proceed to Lamont Bird. And I neglected to say at the outset that your statements in their entirety will be included in the record without objection. Hearing none. Ask each witness to summarize and stay within 5 minutes because I'm sure we're going to have a number of questions from members. So next will be Lamont Bird, Director of Health and Safety, International Brotherhood of Teamsters. Lamont, unmute and testify.
Thank you, Chairman DeFazio, Ranking Member Graves, and members of the committee. Again, my name is Lamont Bird. I'm the Director of Safety and Health for the International Brotherhood of Teamsters, and thank you for inviting me here to testify today. The Teamsters Union represents over 600,000 commercial drivers and other transportation workers who transport goods throughout our nation's supply chains. Most of our transportation members are essential employees who transport groceries and other critical supplies. Our more than 250,000 UPS members are delivering an extraordinary number of packages to our homes as a result of the increase in online shopping. We also represent drivers and other workers in the solid waste and medical waste sectors who are especially key during this pandemic. An example I would like to share with you is the work that our members from the Yellow and Roadway companies recently did for a nationwide retailer of essential goods. In a highly coordinated, time-sensitive move, Teamster drivers delivered plexiglass safety shields to more than 1,500 retail locations so the workers in those stores could operate safely and provide the goods needed in their communities. In spite of being at an unprecedented health risk themselves, truck drivers and other transportation workers continue to perform essential services 24 hours each day, 7 days each week. They deliver goods and perform their jobs regardless of the fact that they may be working in a COVID-19 hotspot. Teamster representatives report that some of our driver members are being pressured to work longer hours and deliver more freight due to significant increases in freight volume. In other sectors, drivers are experiencing significant declines in the number of loads that they transport, and some report being laid off. Drivers report that there continues to be shortages of PPE and safety supplies available to them. Some motor carriers are not consistently complying with CDC guidelines and best practices for COVID-19 prevention. They also report having difficulty accessing food, toilet, and hand washing facilities while on the road as a result of businesses being closed or having policies that restrict visitors from using them. Teamster locals are picking up the slack by making masks for our members and producing and distributing massive quantities of hand sanitizers for drivers to use while on the job. Commercial drivers have an important role in ensuring that our nation has stable operational supply chains. Studies suggest that they may also be key workers relative to acquiring and transmitting diseases that are spread from person to person. Commercial drivers travel extensively, come into contact with large numbers of people, and have higher rates of obesity and chronic conditions. These factors combined suggest that truck drivers may be at increased risk of exposure to SARS-CoV-2, experience more serious illness should they develop COVID-19, and may spread the disease as they travel. Truck drivers and all transportation workers need forceful science-based legislation and health and safety regulations. Regulatory agencies need the funding, staffing, and authority to enforce those regulations, and employers need assistance to ensure that they can manage the economic challenges they face due to the pandemic. To that end, Senators Cantwell, Markey, and Blumenthal recently introduced the Essential Transportation Employee Safety Act of 2020. This bill would, among other things, compel trucking companies to come clean and disinfect their trucks in accordance with CDC guidance. It would also assist drivers in getting PPE and priority testing in the case of exposure. This international union strongly supports this legislation and encourages that it be passed into law. We also need an OSHA emergency temporary standard on airborne infectious disease. The Every Worker Protection Act, introduced by Congressman Scott in the House and Senator Baldwin in the Senate, would require this standard to get done. Drivers are at a high risk of exposure when they make deliveries to warehouses, nursing homes, or other work sites. Making sure that the workers that they encounter during these deliveries are covered by an OSHA standard will go far in helping to keep truck drivers safe while on the job. Drivers also need their employers to be able to weather these troubling times economically. In passage of the CARES Act, Congress foresaw the challenges that many essential businesses would encounter when operating in a pandemic environment. It is important for small and large trucking companies to have access to resources made available under the CARES Act. When the economic recovery begins, shippers will be counting on motor carriers, large and small, to transport their goods. We need them and their drivers ready to answer this call. There's never been a more challenging time to be a transportation worker. Conditions our members have been working under during the pandemic are unprecedented, and our members continue to provide nonstop service to keep our nation's supply chains operational. I again would like to thank you for the opportunity to share our thoughts with you, and I'm available to answer any questions that you may have. Thank you.
Okay, thanks very much, Lamont. Now, Susanna Carr, flight attendant for United Airlines, on behalf of the Association of Flight Attendants, CWA. Susanna?
Chairman DeFazio, Ranking Member Graves, and members of the committee, thank you for allowing me the opportunity to speak with you today. I've been a flight attendant for United Airlines and a member of AFA since 2015. What began as a means to see the world turned into the career of my dreams. I take pride in my role as one of aviation's first responders, a professional certified by the Federal Aviation Administration. When reports of COVID-19 began to circulate, I, like many, hoped it would be contained, it would be addressed swiftly, and that the impact to our industry would be minimal. What began as a few canceled flights to Asia quickly escalated to a full pull down of our flight schedule. My life and the lives of my coworkers were immediately disrupted. Overnight, our industry went from thriving to at risk of total collapse. Within a matter of days, the security of our jobs came into question. If something didn't change fast, not only would we be without our careers, we'd be without our health insurance during a global pandemic. Without the swift action of Congress in the drafting and passing of the CARES Act, I would be on furlough now. Because of your leadership, I kept my job. I'm able to pay my bills and have the peace of mind that a paycheck and medical insurance coverage provides, particularly in a time of crisis. I want to work, and I've remained on active status with my airline throughout the pandemic. But my last working flight was on March 22nd, 2020. It was a return flight from Zurich, United's last direct flight. I remember how concerned the passengers were about being able to get home. Many were wearing masks or covering their faces with scarves or other clothing. Some had on gloves. Many of our passengers refused to take any of the service items from us, trying to limit their contact. You could feel the tension on the plane. People were visibly worried about anyone moving around, and they worked to stay away from the other passengers. Although masks were available for emergencies, we were discouraged from wearing them during normal procedures. We wore gloves, which we changed frequently, and used disinfectant wipes to clean our workspaces. We used hand sanitizer each time we came through the galley. As a first responder, I wanted to reassure passengers that I was doing everything I possibly could to get them home safely. We know a lot more now than we did in March about the virus. I know that we need clear, enforceable federal rules for health and safety that will protect our passengers, all of us serving as essential workers, our families at home, and millions of businesses counting on the resumption of safe commercial air travel. I've been ready and on call to report for assignment. My most recent assignment was airport standby. Procedures had changed, and I had to report early in order to complete a brief health assessment and temperature check. I was cleared before I was admitted through security. During my last assignment, the normally busy Newark airport was nearly empty. While on duty, I was called to pre-board a flight to Houston. The gate area was crowded with passengers not following the social distancing guidelines, including removing their masks. When I was released from my boarding assignment, the gate area remained equally crowded. The next time I report to work, which could be tomorrow, I will be required to submit additional health assessments, which include self-examination and a temperature check via company application. Each time I come to work, there is a risk of exposure. I haven't been able to visit my mother in over 3 months because she's in a high-risk category. My coworkers and I worry about bringing this virus home to our loved ones. COVID-19 remains an unprecedented threat to aviation. The traveling public needs to feel confident that they are safe to travel and be aware of the changes made for their safety. Creating a unified set of rules for all airlines ensures there's no confusion or personal interpretation of safety guidelines. The Department of Transportation has taken steps to protect the health of passengers before, requiring passengers to refrain from smoking and to wear a seatbelt while seated. In a post-pandemic world, wearing a mask should be no different. Based on my years of experience, I know that a federal mandate to require all passengers and crew to wear a face mask while in the airport and while on board the aircraft is necessary. The virus is a safety threat that we cannot see, and yet we must continue to do everything in our power to protect ourselves and the passengers who have placed their trust in us. I believe that clear federal rules will also help rebuild confidence in air travel and allow us to play our role in the country's broader economic recovery. Although air travel is slowly picking up, it is nowhere near the level that it was before the pandemic began. We will almost certainly need continued support after September 30th. That is why Congress must act now to continue the work the CARES Act began. Payroll support needs to be continued through at least January 31st, supporting workers like me during a recession and ensuring we can continue to contribute not only as aviation's first responders, but as part of a recovering economy. Without an extension, mass layoffs are surely a certainty. My fellow aviation workers have shown incredible bravery as they've continued to work on the front lines of this pandemic. We shouldn't have to depend on the goodwill of carriers or on voluntary international standards to keep us and our passengers safe during this health crisis. We need a mandatory federal standard to keep everyone safe. We are counting on Congress and the members of this committee to get through this difficult time. Thank you for inviting me, and I look forward to your questions.
Thanks, Susanna. I appreciate your testimony. We'd now move on to Tom Shaw, transit operator for SEPTA in Philadelphia, on behalf of TW Transportation Workers Union. Tom?
Thank you, Chairman DeFazio, Ranking Member Graves, and all the members of the Committee on Transportation and Infrastructure for inviting me to discuss the impacts of COVID-19 on frontline transportation workers. I'm a bus operator for SEPTA in Philadelphia and a member of Transport Workers Local Union 234. I've been a driver for over 20 years. I served 10 years in the United States Army driving heavy equipment through war zones. My service in the military ended in 2005 when I was critically injured in Iraq. After 18 months recovering, I joined SEPTA in 2006. Like other veterans, I'm proud that I've been able to continue serving my community at home, just as I did overseas. Throughout this pandemic, my focus has been protecting my wife and 4 children, ages 8, 10, 12, and 13. Last year, my 8-year-old was hospitalized due to a viral infection that is a relative of the coronavirus. Even in normal times, I took precautions to ensure that it did not increase his exposure to respiratory diseases. His condition puts him at an elevated risk for COVID-19, and I'm terrified that providing for my family puts him at a greater risk. My biggest fear is that I will either pass it along to him or be forced to quarantine from my family. Before the pandemic hit, the first thing I did when I got home from work was hug my family. Now the first thing I do is throw all my clothes in the wash, shower, take my own temperature. I'm constantly looking for signs of infection in myself. I am the primary income earner for my household, and I have to keep working so I provide for my family. But I often worry about the increased risk my work is posing to our lives. At the same time, I feel a sense of duty to my community to keep our transit system running. Each night on the bus, I see nurses going to hospitals, grocery store clerks going home to their families, as well as other essential workers. They need my bus to help fight the effects of COVID-19 and keep other families fed during the crisis. None of us can work from home as our government has asked others to do. We are all at risk on the front lines of this pandemic, but we continue to work to keep our country safe. Frontline workers have asked very little during this extraordinary time, only that we be given the protection we need to keep ourselves safe. Those protections have never fully arrived. At the beginning of the crisis, I had to buy my own personal protective equipment, including masks, gloves, sanitizer, and disinfectant. A mask has become the most important part of my uniform and should have been available to every transit worker from day one of the pandemic. Transit agencies should require all passengers to wear masks. SEPTA made masks mandatory last week, but too few agencies are following suit. In my experience, fewer than half of my passengers currently wear a mask, despite CDC guidance that shows this simple step is the most effective action we can take to limit transmission of the virus. Social distancing has never been enforced on our transit systems. For much of the crisis, the most effective way of keeping drivers and passengers at least 6 feet apart was to require passengers to board through the rear door and block off seats near the driver. In Philadelphia, this required shutting down the fare box and making transit free. For budgetary reasons, SEPTA recently ended this practice and now again requires passengers to board through the front door immediately next to the driver. I'm relatively lucky, as of all the buses SEPTA is currently using have a shield to keep drivers safe. However, these shields were designed to prevent assaults, not stop a virus. These partitions are better than nothing, but they are not enough to create a safe working environment. Social distancing has also been made more difficult because of other actions taken by the city and SEPTA in response to the pandemic. Decreased service has created long lines at bus stops. Drivers have no realistic way of keeping people from boarding a bus that may already be at capacity, especially on night shifts like I've had to work during the pandemic. There has been a large increase in homelessness people on our buses. Buses are not equipped to provide housing or care for people. They're not meant to be shelters. In these circumstances, I've frequently had to diffuse altercations between passengers. Every time this happens, my chances of exposure increase. This problem has also increased the need for cleaning and disinfecting buses more frequently. Buses need to be cleaned multiple times a day. We know the virus can live on surfaces. Failing to clean a bus is almost certain to spread the disease. This cleaning is not happening at the level required to prevent infection, and many buses go days without being disinfected to CDC guidelines. These ongoing problems have resulted in high infection rate for public transportation workers. 5 TW members in Philadelphia have died from the virus, and there have been 160 confirmed positive cases. SEPTA is not unique. Nationwide, 122 of my colleagues in the TWU have died from the virus. Altogether, nearly 10% of TW members have died, tested positive, or been quarantined due to COVID-19. On behalf of all transit workers, I thank the committee for highlighting these issues for the actions you've already taken to help address them. We need mandatory requirements from the Federal Transit Administration on health and safety during the current crisis. These requirements must include PPE for workers, masks for passengers, social distancing measures, and cleaning standards. While these measures are just one piece of the puzzle, they are absolutely essential if we want our public transportation systems to come out of this pandemic as safe, accessible, and reliable in the future. Thank you, and I look forward to answering any questions.
You're on mute, Mr. Chairman.
I just got it. Thank you, Thomas. I now turn to the ranking member of the subcommittee on aviation, Garrett Graves, to introduce our next witness. Garrett?
Thank you, Mr. Chairman. Mr. Chairman, I'm pleased to introduce Mr. Randy Guillotte, who is chairman of the American Trucking Association and the past chairman of the Louisiana Motor Transport Association, the important affiliate in the state of Louisiana. Mr. Guillotte has over 30 years of experience. His grandfather, Mr. Petrie, established Southeastern Motor Freight in '85. He established, together with some others, Triple G Express. They both do intermodal transportation services, largely out of the Port of New Orleans. Randy has done everything from working on the dock and safety to driving and working as an executive within the trucking industry, has a fantastic perspective, oversees over 100 employees, and is very much focused on the worker. But as you know, the American Trucking Association really is the voice of that freight moving across the country, and very pleased that he's here to join us today, and looking forward to his testimony. Thank you, Mr. Chairman.
Thanks, Garrett. Mr. Guillotte, please proceed with your testimony.
Thank you, Chairman, Congressman Graves. Thank you, Chairman DeFazio, Ranking Member Graves, and members of the committee. My name is Randy Guillotte, and I am president of Triple G Express and Southeastern Motor Freight, motor carriers based in Jefferson, Louisiana. It's my honor to speak with you today as chairman of the American Trucking Associations. For 87 years, ATA remains the largest national trade organization representing the trucking industry. With affiliates in all 50 states, our membership encompasses more than 34,000 motor carriers and suppliers, representing every segment of the industry. The COVID-19 pandemic thrust America's trucking industry to the forefront of our national consciousness. As most activity across the country ground to a halt, America's 3.5 million professional truck drivers kept moving. These heroes continue serving on the front lines to ensure everyone has the goods they need to get through these challenging times. Truckers are the difference between a fully stocked grocery store and one line with empty shelves. They're why doctors and nurses have PPE to protect themselves. They're how test kits get to hotspots for local officials to use to fight the virus's spread. The health of our nation, of our entire economy, rests on the strength of these heroes and our industry. When we lack the capital, resources, or clearance to do our job, the impact is felt immediately, far and wide. Not only by us, but by the people we serve, our customers, grocery stores, pharmacies, hospitals, first responders, farmers, manufacturers, business owners, and the consumer, the American people, just to name a few. That's why we've worked with policymakers at all levels to ensure these critical supply lines are not disrupted. And that begins with protecting the safety, health, and well-being of our most critical asset, our workforce, our drivers. That means ensuring state officials keep public rest areas open. Truckers, like any human beings, have basic needs. They need places to rest, places to eat, and places to use the bathroom. Otherwise, truckers can't do their job safely and efficiently. It also means expanding PPE access across the industry. While large fleets might have resources to acquire PPE at scale, our association has stepped up to help provide for small and mid-sized carriers. To date, we have obtained and distributed more than 150,000 face coverings to our members at cost, and partnered with the Department of Transportation to distribute more than 1.5 million more to frontline truckers across the country. We have also stationed more than 1,100 gallons of hand sanitizers along major freight corridors where drivers can replenish their personal supplies at no cost. Finally, I'd be remiss if I did not note Chairman DeFazio's introduction of a comprehensive infrastructure bill last week. Let me be clear. The single most important action of this Congress can take right now to support our workforce and to provide for their safety is to invest in our infrastructure. Roads and bridges are not Democrat or Republican. We all drive on them. For the 7.7 million Americans in the trucking industry doing our jobs day and night, moving our economy, we ask members of this committee to do theirs and pass a bipartisan infrastructure bill this year that meets the urgent needs of our economy, our industry, and the motoring public. Thank you for working with us to ensure America's trucking industry has the support it needs to serve our country through these tough times and into a better tomorrow. I look forward to answering your questions. Thank you.
Thanks, Randy. That concludes our witnesses. And now we'll proceed to questions. The staff has provided a list. It looks like we have extraordinary attendance today. Thanks to everybody. And we'll try and move along quickly. And as I said, it'll be done in the usual order. First, I'll claim my time. And first to Ms. Carr, if you could unmute. I'd just like to discuss what you talked about in terms of observance at the gate recently of people not following the guidelines. And were they admitted to the plane while still not following the guidelines?
So, Chairman, they would take their masks on and off. Again, there was a lot of crowding around the gate area. People were very eager to get on board the aircraft, as they generally are. And despite, the guidance from our gate agents asking them to, to space out, to keep the 6 feet, people were again too eager to get on the plane. As I was coming off, again, there was crowding. My coworker and I, who were both trying to exit the area, we were pressed up against people just trying to get out.
Mm-hmm. Have you heard from any of your coworkers about people refusing to wear masks on the plane?
I have seen instances on social media through my coworkers where they have discussed the fact that passengers, don't like to wear the mask, might take it off for a longer period than just to eat or drink. It's definitely an issue that we need to address.
Do you think if we said seat belts and not smoking are just a voluntary airline rule, that we would be getting the levels of compliance we're getting today? Because it's an FAA and will be enforced by the federal government?
Because we have that security of the federal government giving us that backing to do our jobs and enforce no smoking on planes, enforce seatbelts, by enforcing masks, people, I believe, would have to listen to that. I believe there would be less pushback and less mistakes about what is acceptable at this point when you're traveling on an airplane.
Okay, thank you. To Mr. Willis, Larry, if you could unmute, and you could, and yes, thank you. On the issue of OSHA, you mentioned OSHA and the lack. Want to just expand on that a little bit? What would fighting sectors?
Sort of breaking up there, but I think you're asking about the OSHA emergency temporary standard. I think from a transportation worker perspective, both the OSHA temporary standard and the modal specific requirements that we've been discussing here work hand in hand. I think Mr. Chairman, OSHA jurisdiction on the transportation side can be a little hit and miss. We do know that in the transportation side, there are sort of uniquenesses about these industries that I think require the nodal agencies to really step in here. You raised a question about, empowering the flight attendants to enforce the mask rule. I think that has to happen through an FAA directive and then giving them the authority, again, in conjunction with the broader approach that OSHA offers. And finally, as we talk about masks in the context of aviation, I think if the first security officers, if the screeners were here, they would say that, in addition to the aircraft, we need to make sure that passengers coming into the screening area are wearing masks, and that's enforced at a national level so that they're protected from this virus as well.
Okay, thanks. And then finally, quickly, mute again, thanks. And quickly to Mr. Shaw, if you could unmute. I think you said that a lot of your assistance for PPE came through the youth and not through the employers. Is that correct?
Yes, Chairman Graves.
Okay, that was an answer. I said Graves, but okay. All right. With that, I'm going to move on to Ranking Member Graves for his question. Ma'am?
Thanks, Mr. Chairman. My question, I only have one right now, and it's for Mr. Galloyd, if you could unmute. And you mentioned that the shutdown of certain businesses and obviously certain regions has caused challenges to the supply chain, and it's kind of thrown off the balance, or has thrown off the balance of our freight systems. And I'm just curious how your members are addressing that, and does this threaten the long-term viability of their supply chains?
Well, as it was mentioned earlier in discussion, certain segments of our industry are busy still with consumer type goods, but many segments of our industry that are servicing fuel deliveries, for servicing the oil field right now, for servicing car manufacturers and other types of factories that are shut down because of the pandemic or just getting back up and going now. It certainly has disrupted the entire supply chain. So we're looking forward for the economy to get back going again, and that we can try and bridge the gap on the deficiencies now with the supply chain versus what we were experiencing before. So will there be long-term effects? I think the longer the slowdown is, the worse it's going to be in recovery. But I think if it's shortened timeline, that we'll be back in the supply chain, we'll be back to normal. Our workers have been up to the task. We've been at the front lines delivering, and we will continue doing that as an industry. Thank you.
Do you have an estimate on how long it might take to get back to normal?
Our economist, for ATA has projected towards the end of 2021 might give us some sort of normalcy again. We're experiencing a tremendous slowdown in the second quarter this year. Some estimates are as high as 35%. And while we're looking for an increase in the economy in the third and fourth quarter at measurable lengths, it's still going to take that long to get back to normal if, in fact, the projections are correct.
Thank you.
Thank you.
How are you, Mr. Chairman?
Sam, we'd now move to Eleanor Holmes Norton. Eleanor, unmute.
Yeah, I hope you can hear me and see me. Mr. Chairman, I do want to thank you for this hearing. I think it has been really important to hear from these leaders on the front lines who are experiencing the most exposure and who can help us the most. Indeed, I have a question really for all of them. My own district, the nation's capital, and the surrounding region was the last to open. It was a real hot spot. And now it is inching to open. It is inching toward reopening right now. For those of you on the front line who are now seeing the virus resurge in some parts of the country, would it be your advice to cease reopening so quickly? Or do you believe the kind of reopening at various levels, and I must say, in various jurisdictions, do you believe that reopening should continue in light of whatever exposure you think your own workers may have as a result? I'd like to hear from all of you on that, because all of you are exposed.
If you could all briefly address it.
Sure. This is Larry Willis. I mean, I would just say that, obviously local jurisdictions and states have to, work with their public health officials to make those determinations. From a transportation worker perspective, and, we can talk about this more during the hearing, but as more and more density occurs on our transportation network, as we start to reopen, whether it's on transit, passenger rail, obviously the airline side, I think the social distancing, the PPE question, how we test in the right way, really is crucial today, but it's going to take on even added importance because the nature of transportation and workers in many cases are going to be next to their co-workers, next to passengers, and you have more people using the system. We can constantly rethink what we're doing to protect both workers and passengers.
Do any of the rest of you, Mr. Byrd, in light of your own workers, Mr. Carr, Ms. Carr, in light of your own workers, I would appreciate your advice.
Okay, I could answer. Thank you, Congressman Norton. I am a DC resident myself, and thank you for your service. Yeah, we're very concerned about the rate at which the states are reopening. We think that the policies that are being implemented in the states in terms of the pace at which states are reopening is kind of outpacing the science. The experts are telling us that we're still in a pandemic, and given the activities, the protests and the reopening, we've seen increases in certain states that have reopened. So there are indications that this may be a bit premature, and we need to do this very slowly, very carefully, and incrementally.
Thank you very much, Ms. Carr, Mr. Shaw, Mr. Giat. Do any of you have any views on that could be helpful to the committee?
Briefly, quickly.
Congresswoman, thank you for your question. Yes, I do believe that as we're opening up, we need strong enforceable guidance as to how we open up, masks, et cetera. And then certainly for travel, we need social distancing and respect of fellow passengers.
Right.
Congresswoman Norton, this is Randy Gilliott. Our industry is very eager to get the economy back to a normal circumstance while recognizing the importance of health for our entire workforce and the public. So we're extremely concerned. We make sure that we're following CDC guidelines as well as OSHA guidelines, and in particular, looking forward to following the guidelines of local jurisdictions since they are different from one to the next, and our industry is reversing those each and every day. Thank you for your question.
Thank you very much. I think my time has expired.
Thanks, Eleanor. We now move on to Representative Crawford. Unmute.
Hey, thank you. Thank you, Mr. Chairman. Question for Mr. Giat. I hope I said your name properly. I want to get some insight from you about the trucking industry. Unlike other industries that have been able to work remotely through the crisis, that's not the case for truckers. And you've helped lead through our COVID response efforts. Truckers continue to work around the clock, delivering goods to grocery stores, medicine to hospitals, PPE to first responders, and things of that nature. And just as they led the response, truckers will also lead the way on recovery. You're the driving engines of our economy. As we pivot from COVID response to recovery, what are the policies that you and the trucking industry believe should be considered by this committee and Congress?
Congressman Crawford, thank you for your question. You know, we are definitely concerned and want to make sure that we're following the guidelines by CDC and OSHA. We're also concerned with receiving limited liability protection from excessive litigation. We're not trying to protect bad actors in our industry. We certainly want to be good stewards of health for our entire workforce. But we are extremely concerned with frivolous lawsuits that may come out of this health event and make it into a legal event instead. So that's concerning to us. Thank you.
Thanks. Anything else that you think we should be looking at beyond that from a policy perspective?
Well, I'll say this, as in my original statement, infrastructure is number one for our industry. We feel it's critical for this committee here to lead the way on a bipartisan bill that can pass this year and to fully fund a robust infrastructure package going forward.
Thank you. Appreciate your insights, Mr. Chairman. I yield back.
Thanks, Rick. We'd move on now to Representative Johnson.
Thank you very much, Mr. Chairman. And let me thank all of our tremendous witnesses today and sitting here listening to their concerns during this very serious pandemic. It reminds me, frankly, that I have the largest Teamsters local in the nation in my district at Local 745, and that is the crux of our economy. And I'm trying, and of course, American Airlines is also based here where we have lots of traffic. Transportation, frankly, is the crux of the economy in Dallas, Texas, and surrounding areas. And I know that there's so much vulnerability. I'm trying to see what we can do now to support more safety for all of these frontline workers, because I consider transportation to be frontline. I'd like to see if there's anything that we might be able to do, knowing how long it takes us to get to the legislative cycle of things. But there might be some recommendations or support that we can offer for some of the measures that are in place now, if they can comment a little bit on what that might be.
Anyone wish to comment, please unmute.
Yes.
Congressman, the trucking industry appreciates the relationship that we have with the Department of Transportation and FMCSA. They've been very responsive through this pandemic and assisting us through short-term initiatives such as hours of service relief. So we would like to continue working with those agencies for the benefit of our workers and the benefit of our industry. Thank you.
Thank you. Mr. Willis.
Well, look, I would just say that, employers, as I said in my opening statement, they've been really hit and miss. It's gotten better over time, but there's still a lot of places in the broad transportation side. Mr. Carr talked about this for transit. Definitely more of a problem on the private sector providers than the public. Where, again, this is where I think you need, mandates from the federal government, you need enforceable standards. Because without that, I think you're going to see more of a hit and miss approach to this. And as I said earlier, as we move, we start to reopen, different parts of our country, we're going to see more people using public transit. We're going to see more people on airplanes. The ability to social distance is going to get harder and harder. We need to think of new strategies to make sure that we are adequately protecting our workers. And again, I think it really starts with strong federal mandates from DOT, from the modal agencies, in conjunction with the OSHA emergency temporary standards.
Thank you very much, Mr. Byrd.
Yeah, thank you, Congresswoman Johnson. We understand that the legislative process can be quite time consuming. In the interim, we certainly advocate for a strong federal regulation or standard, but in the interim, if the Congress could give the occupational safety and health the authority to enforce the CDC guidelines and the other best practices immediately, we think that would go a long way in actually compelling employers to implement the social distancing and the use of personal protective equipment and other measures that have been recommended through CDC.
Well, thank you very much. I have very little more time, but Ms. Carr.
Just quickly.
Thank you, Congresswoman. I do believe that we need a federal mandate for safety standards. Our passengers need to feel confident returning to air travel, which will in turn help our economy.
Great.
Thank you very much, Mr. Chairman.
Thank you all for observing the time. Would now go to Representative Gibbs. Bob?
Thank you, Mr. Chairman. Thank you to all the witnesses for being here today. I just want to, on the previous question from a member from Washington, D.C. about the rate opening up, I think it's important to remember there's more testing going on and the severity of the cases, but we get more people that maybe test positive, but we're seeing out here in Ohio and in the middle of the country is the hospitalizations rates and the death rate is trending down, which is a good thing, obviously. And I think that's what's really important. I think we're going to see more people. That's good. It's good to hear. I think the flexibility that we passed almost unanimously out of the House and Senate last week, and the President signed it, was absolutely needed to be done. Mr. Byrd, the recent finalized revisions of the Federal Motor Carrier Safety Administration's hours of service rules change overall driving time for commercial vehicle operators. How's that impacted your members with the changes?
Well, we're going to have thank you for the question, Congressman Gibbs. We're going to have a significant number of our members affected. I think you're referring to the changes to the short haul provision and rest break provisions. We have a fair number of members who are going to be affected by this. We were not supportive of those changes because we are very concerned that by extending the workday for these workers as they're performing very physically demanding work, that we think they're going to be a significant increase in the number of occupational injuries. So we're very concerned about that, but it hasn't gone into effect yet. It's something that we'll be closely monitoring.
Okay. Well, thank you. Mr. Chairman, I yield back and just close with saying that I think we can open up the economy as fast as we can, but do it with common sense. And we're seeing some good things happening out here in the middle of the country. So I yield back. Thank you, Mr. Chairman.
Thanks, Bob. We now turn to Representative Larson.
Thank you, Mr. Chair. Coming to you live from Washington, D.C. First question is for Ms. Carr. If you could unmute. Ms. Carr, new technology is being developed and deployed to improve cleaning and sanitation across transportation modes, but I wanted to focus specifically on the cabin, the airplane cabin. How do you think the use of some of these new technologies are impacting the workforce health and safety?
Thank you for your question, Congressman. I am actually not well versed on that, but I will have a member of my union get back to you.
All right, that's excellent. Thank you very much. Then I'll ask the same question of Mr. Byrd about any new technologies being used to ensure a clean workplace, a clean workforce, as well as for your drivers in the Teamsters Union. Anything new being done in terms of health and safety?
There are no new technologies that I'm aware of, and I do directly deal with the occupational health and safety related issues with our labor union. I am completely unaware of any new technologies being employed. We're primarily relying on when it comes to cleaning and disinfection, we're relying on using products from the EPA's approved list of cleaning and disinfecting supplies. That's about the extent of it that I'm aware of, sir.
Thanks. I'm going to go back to Ms. Carr. Since 2015, I and some others have called for a national aviation preparedness plan to ensure that all levels of government, airlines, airports, other aviation stakeholders are better prepared for future public health crises. Now, from your experience with the COVID-19 pandemic, what priorities would you include in such a plan for a national aviation preparedness plan to prepare for public health crises like COVID-19?
So, Chairman, I have to say, when the spread began, I was surprised that there was not a more wide sweeping plan in place from our government. And I think moving forward, that is something that we need to have. Obviously, that would change slightly based on what the crisis is. But as an example, the fact that early on we were not wearing masks, we weren't wearing gloves, passengers were exposed, we were exposed. These are all issues, as well as testing from the get-go, having different stop points to ensure that a passenger who may be infected is not getting all the way to the plane. They're stopped before that. These are all steps that we need in place, cleaning provisions. All of that should be outlined so that when a crisis like this occurs, we can immediately move into a plan of action.
Perhaps one of the lessons that we can learn from this. Thank you. Mr. Shaw, in my district, Island Transit, Community Transit, and the Whatcom Transit Authority and other local transit agencies have implemented rear door boarding, installed protective shields, and you've discussed some of those, suspended fare collection. From your experience at SEPTA, are these measures effective? And do you think any of these practices or any others should be implemented permanently?
We did have rear door operations, and they were effective, and we were able to block off or lift up the front seats to keep the social distancing. But as I testified, the budgetary issues where they went back to the front door, the biggest thing is sanitizing, cleaning, more guidelines, stricter guidelines to keep the buses clean, and guidelines to be able to enforce wearing masks. People just don't wear them, and there's no way as drivers that we can enforce them without causing confrontation and putting ourselves at greater risk.
Thank you. And then finally, Mr. Guillat, did any of your members, when the pandemic first hit and you had states closing activities, have problems with truck stops, the ability to stop at truck stops? You mentioned rest areas. What was your experience with private truck stops?
Truck stops as well. In many cases, especially the restaurant and the ability to use restrooms within the truck stops initially. We worked together as an industry, and I think that problem became less significant as the days and weeks went along since the beginning of the COVID-19 pandemic. So initially, yes, I think it's much better now.
Great.
Thank
Thank
you.
you. Thank you, Mr. Chairman.
Great. Representative Webster. Unmute. Rep Webster, did you leave? Okay. Representative Massey.
Thank you, Mr. Chairman. Can you hear me?
Yep.
Ms. Carr, you mentioned some national standards for aviation for the passengers and also for the flight attendants. What standards would you like to see if we did come up with some federal guidelines or standards for air flights?
I think one of the most important ones right now is going to be wearing masks in the common areas of the airport, and then wearing masks on board the aircraft, both for crew members who are working and for passengers who are traveling with us, as well as social distancing. The CDC has come out and said that wearing a mask is one of the best ways to prevent contracting and spreading this virus. So having those steps in place, I think, is vital.
And when you're provided a mask by your employer, do you get an N95 mask or a lesser mask, or what types of masks are flight attendants provided?
So there's going to be a variety. Naturally, the N95 has been said to be the best mask available. However, not only are the airlines trying to get this, but so are our frontline health officials and everyone else in the country. So I've seen a variety of masks made available.
Would you prefer to have the N95 available for flight attendants?
I'd absolutely like to see the best masks available to our frontline workers, including flight attendants.
Okay, same question there for you, Mr. Shaw. What kind of standards would you like to see in transit?
The standards that I would like to see is the sanitizing of the buses. I don't believe that my employer is taking it seriously. I'll do multiple trips, multiple times a day, and my bus will not be cleaned. Standards from the federal government for sanitizing the buses, I believe that would definitely help. And again, masks, making the passengers wear the masks. They're not wearing the masks. They're coming on, and all I can do is ask them to do it, and they just look at me and pass by. So some type of standard and ways to enforce that would definitely make this job a lot safer.
If they don't have a mask, are you able to provide them with one?
No, I don't have anything to give them, and I'm just told to ask them to wear it and allow them to ride.
Okay. And what kind of mask are you provided with by your employer?
We've been provided with disposable masks, neck gaiters, a cloth mask, and masks that other operators make from home. We haven't been given any N95 masks at all.
Okay. It's my opinion, and I guess this is also supported by scientific studies, that if you want to try and protect the wearer from contracting the virus, that you would need something like an N95. And if that's the circumstance, then I would think that the flight attendants and the operators of transit should at least be provided that level of a mask. Whether that's a federal policy or not, I don't know whether we should come in with a one-size-fits-all, but we should definitely apply some science to these standards, whether they're state or employer or federal. Switching gears, Mr. Guyot, can you tell me if there are still any issues with truckers being able to find or get access to appropriate restrooms and restaurants? Are there any states in particular where you're having difficulty still?
I'm not aware of any at the present time right now. There may still be some limited access, if you will, but nothing in a critical stage like it was at the initial onset of the pandemic.
So there's been some talk that there might be another flare up of the virus as we open back up or as we get into the cooler months. Do you have any recommendations for states, since this is sort of a state by state basis and ad hoc? Do you have any recommendations for the governors if they do implement, more stringent, restrictions, what to avoid in order to keep from making truckers' lives more difficult than they already are?
As we have worked with the jurisdictions at the very onset, I would recommend to keep our workers in mind because we are critical for keeping the economy going. We are critical for delivering the essential goods, not only to our healthcare workers, but to the rest of the entire economy, to the American people, the grocery stores. You know, the biggest conversation at the beginning was there's no toilet paper left on the grocery store shelves. So, you know, as we say, we're moving America just to be able to keep those basic necessities for a truck driver available. Please keep that in mind.
Okay, thank you very much and stay safe, you all. I yield back, Mr. Chairman.
Thanks, Thomas. Representative Napolitano.
Thank you, Mr. Chairman. Thank you to all for being such incredible workers during this very harsh time. How is transportation industry keeping workstations clean during shift changes? And have you tried, or are they considering the fumigation, such as the airlines some of the airlines have instituted to all of you? Hello?
Thank you for the question, Congresswoman. This is Lamont Byrd. We have not seen any fumigation approaches to providing cleaning and disinfection. In fact, I've read some studies, and not too long ago, that actually questioned the efficacy of taking that approach to cleaning and disinfection. But we have not seen that being employed to this point in the facilities where we have members.
Well, that's interesting. Then how would the airlines be using it and not know that? Ms. Carr, Secretary Mnuchin and the Treasury have not been willing to enforce the CARES Act. Would you care to talk on that?
Without the CARES Act, Congresswoman, right now I would not have a job and I would very well not have my medical insurance. This act was historical. Payroll protection for workers is absolutely vital during this time.
Yes, but they're unwilling to enforce it.
We absolutely need to see enforcement across the board, and I can have my union get back to you on how they'd like to see that accomplished.
Thank you very much. The partitions, one of you mentioned the partitions are not enough, but LA has started a long time ago, put partitions in. Do you think that would be helpful? Maybe even asking the bus manufacturers to create something. What would you comment on that?
Thank you, Congresswoman. We do have partitions, but they're short. They don't extend out past the fare box. They're there to stop somebody from punching or throwing a liquid on you. Newer petitions need to be longer and enclose us more to protect us from people being able to come around it.
Would you be able to provide some information or recommendations on that?
Yes, I can definitely have my union reach out.
On the buses that the routes get crowded, has the bus company considered putting extra buses, the same route, to deal with the extra influx of passengers?
My company has done that, but it still hasn't been enough because of the limitations on the people we've experienced as operators, where the people at an intersection would stand in front of the bus and not allow it to move and destroy the bus. There has been no protection for the drivers to prevent these things from happening, and not enough service to provide it. That's, again, one of the biggest things that we talked about was there's not enough service for the people, and it's causing unsafe conditions for the operators.
There is no standard, in other words, and even though they recommend, nobody wants to do it because it costs money. Is that right?
That's correct.
I think these guidelines should be extended, because if we are entering a period where another pandemic, stronger one, may happen, we will not be protected. What would you recommend that we do in order to be ready for at least prepare?
Brief answers.
I've got a minute.
You know, one thing on the transit side that hasn't been discussed here is, you know, someone asked about the air on aircraft cabin. You know, buses can think about this too. I know there's been some discussion with employers to have better filtration systems on the buses connected to the air conditioning system. And again, as I think we move to the summer months, I can be aggressive about that. Can be a good, added way to clean the air in addition to the disinfecting and cleaning that we've already talked about.
Also, the air circulation in the airplanes is important, isn't it?
Yeah, someone, I believe you or someone else raised that, I think it was Mr. Larson raised that issue previously. Air cabin quality is an issue even before COVID, and really major significant problems and things that the FAA and Congress need to do better to make sure that we do have clean air on board the aircraft cabin. COVID-19 has just reinforced, how contained that environment is, and I think really makes it that much more important to deal with those issues on the aircraft cabin.
Thank you, Mr. Chairman. I yield back.
Thanks, Grace. Just in reference to that, I have asked the FAA to solicit a study of circulation in the interior of an aircraft. We do not know how these micro droplets, particularly someone not wearing a mask who coughs or sneezes, or even someone just talking, how they behave in the aircraft. My understanding is Airbus and Boeing are both doing proprietary studies, which we won't see. Airbus is experimenting with reversing the airflow. I'm very concerned. The FAA at this point is totally unwilling and would like to remain ignorant of that issue. With that, I'll turn to Representative Perry.
Hey, thanks, Mr. Chairman. I'm coming to you from the committee hearing room in Washington, D.C. My first question will be for Mr. Guyot and then Mr. Willis. Mr. Guyot, in your testimony, you pointed out that Governor Wolf's efforts to combat the pandemic in Pennsylvania included the closure of our service plazas and rest areas for 10 days. And as you pointed out, the policies threatened not only the safety and well-being of the drivers who were delivering critical medical supplies, food, and protective equipment, but moreover, the policy threatened to disrupt the flow of goods through Pennsylvania into the deteriorating public health situation in New York City, which at the time was the epicenter of U.S. COVID-19. Luckily, in this instance, the governor reversed course and repealed the flawed and reckless policy. Nonetheless, the experience demonstrates the danger posed by the unintended consequences of mass lockdown policies. Do you know, did the 10-day shutdown of the rest facilities in Pennsylvania disrupt shipment of vital goods, and what other operational challenges, if any, did due to the response to the virus, those policies, did any of your drivers or companies face?
Yes. The answer to your question, I do not know of a specific shipment that may have been altered. I do know it disrupted the general flow of commerce through the state of Pennsylvania. We had drivers who was extremely concerned about traversing through there, knowing that there was no facilities to stop and use the restroom, facilities to eat, facilities to rest. So it was extremely concerning. We were glad that our National Association, American Trucking Associations, along with its Pennsylvania affiliate, worked with the state of Pennsylvania to get those facilities back open again.
I sure appreciate it. Thank you. Mr. Willis, in your testimony, you claim that there's a drastic drop in fare box revenue that threatens the ability of transit agencies to continue to provide service at all. And that's, I'm just quoting from your testimony. And then you go on to say, we know that billions more will be needed in the coming months to keep these agencies afloat as they continue to operate without recovering fare box revenue. Now, to me, this testimony is misleading at best. If the service of any transit agency were contingent on the fare box revenue, that agency would no longer exist. As you know, on average, federal, state, and local subsidies pay for 3/4 of their operating expenses. So just to reiterate, 75% come from federal, state, and local subsidy. Moreover, the $25 billion in CARE Act emergency funding for the public transit system exceeds the annual fare box revenue of all transit agencies by nearly $10 billion. So that's a lot of money in excess of what the usual intake at the fare box is. The claim that this will not cover the lost fare box revenue and more is just, to me, quite honestly, it's just a flat out lie. To be clear, The demands for tens of billions in additional emergency relief is a transparent attempt to get the federal government to bail out the transit sector from a crisis oftentimes of its own making. For example, coronavirus did not cause the $106 billion state of good repair backlog and the declines in service that resulted in an 8% drop in ridership from 14 to 2019. Rather, they are the result of decades of financial irresponsibility and mismanagement. More concerning to me is it's unlikely that ridership will recover to this level due to a combination of public transit's central role in the spread of COVID-19 through New York City, as demonstrated in an April 2020 MIT study. Also included the expanded telework options for large sectors of the economy, the migration of both people and business centers away from densely populated areas, and CDC guidance to avoid public transportation if possible. What steps do you anticipate the industry will take to overcome these existential threats, and how can the American people be convinced that public transit is safe?
Well, that's a lot to respond to. First of all, just on the federal support and subsidy point, every single mode of transportation that we're talking about here receives federal support of some way, shape, or form. And we are absolutely support that across the board. We understand that segments of our transportation are going to need, whether it's at the state level, local level, and obviously at the federal level. Transit being a public service is going to obviously require more than airlines or other entities. I do think public transit is going to play a central role here. These are transit workers, these are agencies that have gotten essential workers to their jobs, that have gone to work every day in very unsafe conditions. As you heard earlier from my brother at the CWU union, very high fatalities in this sector of our economy. So yes, we need to make transit safer than it is today. The measures that we're talking about, making sure that we have mandatory rules in place on PPE use, on cleaning and disinfecting, on social distancing. Those are the things that we should be focused on here. And yes, because of lost revenue at the fare box, because of less local taxing, because of lower gas tax receipts, again, at the local level, that's where you're seeing the sucking of revenue that is going to need federal support here, just like other sectors of our transportation system, including aviation, desperately needed. So we're all in this together, quite frankly. Transit is going to be a key part of this recovery, and it needs the support that we've been calling for.
All right,
Thank you for your answers. I yield back.
With that, we turn to Representative Lipinski. Dan, unmute. You there? Dan?
Yep, I'm here. Thank you. I wanted to go back to Larry on the Mr. Willis on, and maybe we also can have some comments from Mr. Shaw on the questions that were just there. Some things that had just been said about the amount of money that was received by transit agencies in the CARES Act actually exceeds the annual fare box receipt, and that there isn't more help that's actually going to be needed for transit to continue on. I know that in the Chicago area, working with the CTA in Metra, I know how much they have not taken in compared to what they usually do, and that the funding that they received in the CARE Act is not enough to make up for that loss. So I just wanted to give an opportunity to Mr. Willis and Mr. Shaw to they want to respond to that.
Tom, you want to go first, or please? I'll start. No, you're right. I mean, obviously, you've got transit agencies that are all across the country. MTA in New York, Metra, CTA in your backyard, that are just seeing rapid fall off I forgot the percentage, but I think, on commuter rail, it's still 90+%. Buses obviously have more traffic. But again, when you think about public transit, it's just not the fare box that you got to think about. It is the local tax collection that they have. And by the way, this is a highway problem as well. We know that highway construction projects are being threatened with being closed down, being suspended, having capacity at State Department of Transportation curtailed with layoffs there because local gas taxes aren't keeping up with those projects. So it's not just a transit problem, it is a highway program problem as well. And as we think about investing in infrastructure as an economic stimulus down the road, if we don't maintain our capacity on the construction side, at state DOT side, using infrastructure investments to grow and restart our economy is going to be that much more difficult. And I would put transit in that exact same bucket. So, we got to support these critical nodes of transportation here to be sure.
Mr. Shaw wants to add anything to that before I come back to Mr. Willis for an Amtrak question.
I would just say that the money that was given to SEPTA, I don't know how they use it or if they're using it. I would say that more money would be to work on a filtration design that would protect the passengers as well as the operators, and more engineered designs on partitions. Again, I don't know what SEPTA is using their money for.
Okay. Going back to Mr. Willis, you mentioned in your testimony Amtrak's recent announcement about laying off or buyout for 20% of their workforce, which also concerns me after they received $1 billion in federal funding. What labor protection with respect to Amtrak should Congress consider in a future COVID-19 package to ensure Amtrak is appropriately treating its workers?
Well, I think there's a couple of things. One is, I do think Congress has to make sure that the Amtrak that we have today is the Amtrak, quite frankly, that we get back after passengers come back and the economy comes back a little bit. It's a national network. It's designed like that. It's supported as a national network by Congress. And allowing this to be an excuse, quite frankly, to roll back on long distance routes, roll back on certain corridors, curtail onboard service, we think would be a mistake. So I think making sure that Amtrak is committed to its system and its network is critical. And yes, I think that just like we did with the CARES Act legislation on the aviation side, making sure that this money is used and goes to payroll, and make sure that those workers are able to stay on the job. As I said in my opening, I think the layoff plan that they've proposed is misguided, and I think pairing funding with an obligation to make sure that money flows to workers and that those furloughs are not done is important.
Thank you. My time is up. I yield back.
Thanks, Dan. With that, I would move on to Representative Davis.
Hey, Mr. Chair, thank you very much. I appreciate the responses, but Mr. Larson kind of asked one of my questions already to Ms. Carr about the psychological impact, or actually, no, that was the one about, how do we make sure that Congress how do we make sure Congress responds to your industries now in case there's another pandemic? Ms. Carr answered that in respect to the airlines. Do any of the other witnesses want to talk about what can we do more that hasn't already been addressed in the questions you've had, and anything you might want to add? Anyone, Larry?
Wait, hold on. Thanks, Mr. Davis, and thank you for the question. Look, just like in aviation, we have got to have better plans in place to sort of deal with these types of diseases. It has really devastated our transportation network. As I said, it took way too long for both employers and I think the government to really get in place and start to impose requirements, protections, for both their passengers and employees. And I think, local plan specific to these transportation providers are absolutely essential to making sure that we're better prepared the next time around here, similar to what Mr. Larson has talked about on the aviation side. So it's a good question, and I think it's an important point. Thank you.
Well, thanks. Obviously, the psychological issues that Mr. Perry brought up about how do we return? How do we get people comfortable to actually get on to our modes of transit and transportation systems? I'm concerned as to how we move forward, and I know that's been a lot of the discussion already. It's very interesting because we've had the same discussion with our medical facilities here in Illinois, where we've had people now scared to go get treated for diseases that we know how to actually treat because they've been told they can't go into a clinic, or before they weren't even able to get access to that. Are any of your systems, and I know Mr. Perry brought this up to one individual, to one witness, but are there anything you are doing to help work with the companies to make sure you get a marketing plan in place to remind people that it is safe to use modes of transportation again? And I'll open it up to you, Larry, and anyone else who wants to answer the question.
Yeah, I know that the transit industry is definitely focused on this. And, I think it's part of their reopening committee that includes membership, TWU and ACU. There is a lot of discussion about how to effectively communicate that these sectors are safe and can accept passengers in the right way. I think part of it is for agencies to be transparent about it, to be able to demonstrate to passengers that they're taking real steps to protect them. Again, especially important as we get more and more density on these systems. And quite frankly, I think we need to do what some agencies are doing, though not all, which is enlist their frontline workforce to show sort of a common front on these issues, both through the unions and the individual workers. So I think that's going to be absolutely critical. I think the agencies that are having these early conversations are enlisting their workers, are getting their advice, and then being able to actually implement it and show passengers that we're all on the same page here, and that these buses and subways and commuter rail systems are safe to return. Because look, many people have to use transit, but there's a lot that don't have to. They can use their cars. They may not, want to go to the office altogether. We need to show them that public transit is still a viable and central way to get to work.
Well, absolutely. I was on the phone with one of my local transit districts yesterday, and it's all about the ridership, or in this case, the lack thereof, and the same comfort factor. Real quick, I have a few seconds left. If one more person wants to respond to the psychological issues of getting people back, please unmute yourself and go ahead and speak.
Thank you. This is Lamont Bird. Thank you for the question, Congressman Davis. One of the things we've done on the trucking side, and especially the residential delivery of packages, is that we've actually worked with our companies to provide information to clients to let them know that we have drop and go instead of requiring a signature. We have disinfection protocols that we're following, and we have our members wear masks and other protective equipment, gloves, as they're making their deliveries to minimize contact with the residents as we're delivering packages.
Great.
So we've done that in conjunction with our employers.
That's great. I'm out of time, but can you make sure that there's some standards in place to make sure my wife doesn't order as many drop and go packages? Hey, I yield back, Mr. Chair.
Thanks, Rodney. Amusing as always. Hope your wife tuned into that.
She's not here. I wouldn't have said it.
Oh, all right. We'll now move to Representative Garamendi. John?
Thank you, Peter. Thank you for the hearing, and as virtual as it is, and it's going very well. So once we all learn how to do it. I have basically 3 questions. The first is, I don't need to have you all plow this field again. But the first question is, should employers be required by law to provide the necessary personal protection equipment during a national health emergency? And let's just start, run down through the list. Willis, since in the order you guys presented, it can be a yes or a no.
Yes, absolutely.
Mr. Lamont?
Yes, I responded, yes, absolutely need to do that.
Ms. Carr?
Yes, absolutely.
Mr. Guerrero?
I would say yes, provided that whatever's required by the CDC or OSHA and those requirements.
Very good. The second has to do with the passengers themselves. All of you have, one way or another, talked about this. During a national public health emergency, should there be a federal requirement that passengers on public transportation be required to obey certain standards, wearing masks or distancing and the rest? Let's run through the list again.
Yeah, I would say yes, and I would extend that to the airline side, both the airport and obviously in the aircraft itself.
Mr. Lamont?
Yes, we would agree with that it should be necessary.
Ms. Carr?
Yes, sir, we agree with that as well.
Okay. The next is not rather a comment about how we might make airline travel more safe. But before I go there, it's clear, at least in my mind, that when we write the next piece of legislation, if that's the HEROES legislation, that these mandates must be in it. People are simply not going to be returning, and Mr. Davis just discussed the psychological issues, until they have a high level of confidence that they will be safe on public transit. The next one deals with those of us that fly. I suspect that's every member of this committee, staff, and certainly Ms. Carr and others that are providing the services on the aircraft. Mr. Blumenthal, Senator Blumenthal, introduced nearly a year ago what we call the Cabin Safe Air, or the Cabin Air Safety Act. We were thinking principally about various contaminants, fuel and so forth, that are brought into the cabin air. We're now seriously thinking about viruses. I understand that the 787, the most modern of the Boeing jets, has an air filtration system sufficient to remove viruses. Should we require that all airlines immediately proceed with the best in the market or in the technology for cabin air safety? Should that be a requirement? And again, this goes back to Mr. Davis's question about the psychological question for the airlines. Ms. Carr, let's start with you.
Yes, sir. I do believe that we need to improve the air quality on board aircrafts, whether that is through HEPA filters or in more advanced air filtration technology. And it's something that once corrected needs to be monitored frequently and improvements need to be made.
Let's run down through the list. Mr. Willis.
Yeah, as we discussed earlier, I think that's absolutely correct. I think for many years now, TPD, ASA, other unions that represent both pilots and flight attendants have well understood that we need to do better on our aircraft cabin quality, and I think this crisis just reinforces that. So we have, and I know Chairman DeFazio has been doing a lot of work and leadership on this issue as well. So there's definitely steps that I think both Congress and the FAA need to pursue here to make sure that the air we're breathing on these aircraft cabins is as clean as possible.
If the other two witnesses would like to comment on it, they're welcome to do so, although it might be a little off their turf.
Yeah, just to say that we would agree with the statements of the previous two witnesses. Thank you.
Very good.
This is Randy Gilliard with the American Trucking Associations. I'll defer to the airline industry for answers as opposed to the trucking industry giving answers for them. Thank you.
And when you personally fly back to Louisiana, you may want to consider this bill, as do
Yes,
all
sir.
of us, I'm sure.
I will actually be in a plane tomorrow going from New Orleans
Exactly.
to Tennessee. Thank you.
Okay, I'll let it, well, one final comment. This bill has been inactive for some time. Peter, I know that you spoke to this a moment ago. Appreciate your support on the Cabin Air Safety Act. Let's see if we can get it in a piece of legislation.
Yeah, thanks, John. Yeah, this is a particular, COVIDs love low humidity. And all of the earlier generations of planes have very, very low humidity because 87s are carbon fiber. They have a slightly higher humidity, therefore slightly less, compatible for COVID. But I am, as I said earlier, very concerned that we have conducted no studies. Generally modern jets have HEPA filters if they're properly, maintained. But the question is, how does the air flow? How do the droplets behave? We don't know, and FAA doesn't want to know.
Well, Pete,
and the airlines don't want to know either, because I've asked them if they conduct the studies. No one wants to know except everybody who flies. So,
Peter, that brings us to what we do, and that is we pass laws and we say, let's get on with it.
I got it. Thank you. With that, we'll go
Yield
to
back.
Representative Katko.
Thank you, Mr. Chairman, and thank you for all the witnesses for joining us today and for your work to keep America running during this unbelievable crisis. I wanted to touch for a moment on a couple of different issues, but before I do so, I want to note that the transportation industry is in a unique position as a result of COVID-19, simultaneously facing immediate public health threat posed by the virus, as well as the pandemic's dire economic impacts. Transportation workers continue to put their personal safety on the line every day to maintain services on America's roads, rails, airways, and seaways, all while the industry as a whole faces devastating declines in demand and usership. Lawmakers have a responsibility to maintain positive and be responsive to both of these concerns as we discuss a pathway to recovery. Although I'm very pleased that the CARES Act provided over $40 million to maintain airport and transit services in my district in central New York, much more must be done to ensure safety and job security for transportation workers as our communities begin the process of safely reopening. Today's discussion has been critical to these efforts, and I look forward to working with my colleagues on both sides of the aisle to address these challenges facing America's transportation industry in the months ahead. Our first question is from Mr. Shaw. Mr. Shaw, in my district, I've heard firsthand from transit workers, many of them, about the importance of rear boarding procedures and other social distancing policies to keep drivers and passengers safe amid the pandemic. In addition to practical safety measures you outlined in your testimony, what do you think can be done to promote public awareness of safety and health considerations on transit systems?
Thank you for the question, Congressman. I believe for us to show the public that what the safety measures are actually being done, if they're actually cleaning the buses at transit loops, I believe that in itself, better filtration systems, if the public sees this, not just hears about it, that it will bring the public back to the buses to transit altogether.
Okay, anything else?
No, Congressman.
Okay, thanks. I got a question for the panel as a whole. Another aspect of the transportation industry that I'd like to bring to everyone's attention is America's motor coach carriers. Despite playing a critical role in our nation's transportation system and facing massive service disruptions and layoffs, Congress has yet to provide substantive assistance to motor coach carriers in response to COVID-19. And given the role that these carriers play in facilitating passenger travel, often in conjunction with air and rail services, can anyone speak to the importance of supporting motor coach carriers and ensuring continuity of services for passengers throughout the system?
Let me start with that, and it's a great issue, and thank you for your leadership on these issues, Congressman. I know it's appreciated. We represent unions that have Greyhound drivers, that have tour bus operators, TWUD, be front and center there. We have members that drive commuter buses as well. These have been virtually shut down, and really has the economic impact here has been tremendous. So again, just like the support that we're talking about for other segments of our transportation system, I do think Congress needs to think carefully and needs to provide specific financial support here. So an important segment of our transportation system, quite frankly, doesn't get raised enough. So thank you again for your leadership here.
You're welcome. Anyone else want to weigh in on that before I go to the next question? Ms. Carr, I wanted to talk about your testimony for a moment. In your testimony, you discussed significant challenges of maintaining social distancing and other public health measures in the context of air travel. And maintaining safe air travel amid the pandemic is a major concern for the committee, but one that I've also heard about in my work on the Homeland Security Committee. And giving individuals the psychological comfort that they're going to be safe when flying is really important. And it's a very difficult task, admittedly. As the FAA and TSA coordinate with airports and airlines to address these safety challenges in the coming months, what efforts do you think should be prioritized the highest to ensure the safety of passengers and workers?
So the FAA can and should enact safety standards that are sweeping for all of the airlines. Having a unified plan that everyone is on board with is going to ensure our passengers know exactly what's going to happen when they come to the airport, regardless of which carrier they're flying. It means that they know whether they're going to receive a health check. It means they know that they need to wear a mask as soon as they enter the airport area. They understand all these protocols and then everything that's going to happen to them once they arrive on board the aircraft. It allows us to do our jobs and focus on the bigger picture of safety rather than small individual incidents that can, potentially disrupt travel. And then again, for us, the ability to gain tests if needed for COVID-19, the ability to continue to wear masks, to have all the safety standards and PPE that we need on board the aircraft. This should be universal. Safety is not a competition.
Okay, so you mentioned the masks and a couple other things. I think you mentioned in your testimony previously increasing the filtration systems on the airlines. Is there anything else that you would suggest that they prioritize?
I certainly know that my union can answer some additional questions on their bigger picture for that, and I hope that they would work with labor to ensure that those are met.
Yeah, make sure you get those to us, and we'll be happy to pursue those for you. But I think your overall point of having uniformity and enforcing that uniformity is really important. So thank you very much. Now you're back, Mr. Chairman.
On to Representative Carson.
Thank you, Chairman. Many transit systems have reduced service in response to declining ridership and lost revenue. From your observations, how has reduced frequency impacted crowding on buses, trains, and in stations?
Unmute someone who's going to answer it.
Yeah, there's no question that reduced service has resulted in higher density on these buses. I think earlier on there was sort of an understandable move to that, but again, as we see jurisdictions slowly open up, I do think agencies need to reevaluate that and try to figure out, what the sort of right mix is. Obviously, you've got a lot of fixed costs in the transit system. You want to preserve your capital. I understand that, but having these crowded buses with no social distancing, especially if you don't have masks and sort of those other procedures in place, is really going to be an issue, and I think it's going to discourage people from feeling comfortable on public transit. So I think being very conscious of that has to be a priority of agencies, again, as we sort of restart sections of our economy.
Anyone else want to answer, Andre?
Thank you, Chairman. Mr. Gio, in your written testimony, you estimate that 65,000 truck drivers have lost their jobs since the pandemic started. Can we expect these jobs to return quickly as freight numbers begin to return to normal? And what do you think the new normal will look like in trucking?
Yes, I do believe that truck driving jobs will come back in short order. You know, we've expected about a 35% downturn in the economy in the second quarter. And we're also expecting a little over 6.5% increase in the third quarter and over a 9% increase in the fourth quarter of 2020, with returning back to normal levels somewhere towards the end of 2021. So as those levels of economy comes back, we expect our industry to grow back to levels that we might have seen towards the beginning of this pandemic in that time frame.
Thank you. I appreciate it. Thank you, Chairman.
Thank you.
Okay, thanks, Andre. Next would be Representative Garrett Graves.
Great. Thank you, Mr. Chairman. First question I had is for Ms. Carr. Ms. Carr, I'm curious if you abide by all of the CDC or other guidance that's issued for safety protocols, or do you think that you should be held liable if anything happens, if anyone comes down with coronavirus as a result of their flight?
Do I believe that I personally should be held accountable, sir? I just wanted clarification on the question, sir.
Yes, personally, I'm sorry.
I do not believe I should personally be held liable. No, sir.
Mr. Shaw, could you answer that same question, please?
I do not believe we should be held personally liable.
So it seems reasonable that if folks are following the appropriate guidance coming from CDC or others, that there shouldn't be not accountability, there shouldn't be liability for complying with the best rules or the best information we have at the time. We certainly can't have the benefit of hindsight if other or more accurate information comes up. In that regard, Mr. Gilliard, your testimony addresses the issue of limited liability protections. As you know, this is unprecedented, this crisis. Trucking companies, in the course of their essential work, are exposing themselves to risk that are not fully understood. Can you describe the importance of that liability protection or limited liability protection in a future recovery package and what that would mean for your workers and people in Louisiana?
Sure. Thank you for the question. It's critical, especially here in Louisiana where we operate. The litigation environment is significant. And without those limited protections, our best efforts may still be litigated. You know, this whole health crisis should not be turned around into a litigation event. We're all working together to be the safest and healthiest for all of our employees, all the motoring public. And you know, we've never asked for bad actors to be protected. All we're asking for is the ones that's acting in good faith in the industry, frontline workers, to have some limited liability in relation to the COVID-19 pandemic.
Thank you. Changing gears a little bit, Mr. Willis, as you may recall, the third bill that we did, the CARES Act, in response to coronavirus, it does provide an air carrier loan program specifically for air carriers. Most air carriers have not applied for loans under that program. Would you support opening up eligibility for those loans to other aviation and aerospace related businesses?
Well, the loan program does not only apply to air carriers, but it is some contractors as well. That relief was designated for the airlines. I think providing assistance to manufacturers and other important segments of our economy should definitely be open for discussion. But quite frankly, I think we should create a different program or use sort of other aspects of the bill to get them cash. Let me speak to the liability question because you raised it earlier. Look, at the end of the day, it's employers who are responsible for providing a workplace that's frequent hazard. And, to the degree that they're not able to do that, they need to be held accountable, quite frankly. And that's long been the case. I don't think anything about the COVID-19 situation sort of changes that. But I think the liability discussion can get us away from making sure that employers do the right thing to protect both their passengers and their employees. And I think as part of that, the mandatory rules that we're talking about.
And Mr. Willis, I appreciate that, and I think my question was specifically asking about the employees and if the employees should be held responsible if the protocols that company or business has in place are consistent with CDC guidance. Last question, because I know I just have a few seconds left, Ms. Carr. If Congress retroactively prohibits work hour reductions, how many more airline employees do you think would be laid off by October 1st?
I apologize. I would not want to speculate as to how wide sweeping these layoffs could be should air travel not improve and we not receive additional support from the CARES Act.
Okay, thank you. We now turn to Representative Titus.
Thank you, Mr. Chairman. I'll direct my comments first to Ms. Carr, and then I would like for Mr. Willis to weigh in. It's very important that we get air traffic back up and people feel comfortable flying and feel safe. And I noticed that you mentioned that you need more clear guidance from federal agencies. No place like Las Vegas would agree with you more. You went on to mention that the AFA has been pushing for expanded government role in screening. Now, we know that the airlines are taking the position that this should be a function of the TSA, but they're frontline workers too, and they've not been immune from the COVID. 6 TSA officers have lost their lives, and about 640 have contracted the virus. And yet, unlike other federal workers, they lack adequate health and safety benefits. In fact, this administration took away health benefits from part-time workers. They're the lowest paid and they have one of the highest turnover. And now we're asking them to put their health on the line. I've introduced some legislation with Mr. Correa to give them health benefits. And there's some other legislation by Payne and Demings to give additional protections. So I would ask you, Ms. Carr, a couple of things. One, do you think it should be TSA that performs this additional oversight? If it is, do you think they should be covered with benefits like other unions are? And third, what alternatives might there be to TSA doing it? The airlines take the responsibility, the airports take the responsibility, local officials take the responsibility working with the CDC. Could you address those questions? And then Mr. Willis.
Congresswoman, anyone who's working in aviation at this point should be properly trained in how to address the situation, as well as have the protection of PPEs. I can't speculate as to who should be responsible, but this is a conversation that we could be having if we were able to develop a unified plan from our government in partnership with the airlines and the workers' unions. Regardless, whomever's assigned to handle testing and monitoring, they should be afforded the proper care, the tools to maintain this standard of care going forward, and all the protective equipment necessary. Those are all things that we need to do to ensure that whomever is responsible for this role moving forward is able to accomplish that task in a safe manner.
Mr. Willis, TSA doesn't think this is their task. They think they're there to provide other kinds of security, but it seems to be pushed on them more and more. Could you address that and their lack of benefits?
Well, right now, we don't even require passengers approaching a screening station to have masks on. So I think, at a minimum, we have to deal with that issue right now. To the degree that you're going to ask frontline CSOs who, quite frankly, are already overworked in many of these locations, to now, whether it's to take temperatures or to, even do some type of rapid testing, I think there's got to be a lot of thought given to who exactly does that. I'm not sure that the frontline CSOs are the right people for that. I think there's protocols that get to think about what happens when someone, refuses to get a test, what happens You know, if there's, you know, pushback or what have you, what if someone tests positive? What if they have a higher temperature? What do you do with that passenger? So thinking about all those issues on the front end, I think is really important. You know, if we're thinking about CSOs, I think making sure that they have the same labor rights under Title V. I know the House has already passed the bill to that degree, but that just drives home again how important this workforce is and the things that we need to do to better protect them.
Thank you. I completely agree with you and think we need to be working in that direction and putting a plan together now with all the people at the table to see just who's going to be responsible, how that's going to work, what you do with the people who are tested positive, and how you work with the airlines and the airports in this, not just let the airlines say, we don't want the responsibility, give it to TSOs. Thank you, Mr. Chairman. I'll yield back.
Thanks, Dina. We now move to Representative Rouser.
Thank you, Mr. Chairman. And first, I want to lend my voice to thanking all of our transportation workers who have performed so admirably during this very, very unprecedented time. Mr. Gilliott, a few questions for you. I noted that in your written testimony, you mentioned the shortage of drivers was exacerbated by the pandemic. And of course, we all are familiar with the fact that that's been a huge challenge for the trucking industry for some time. But for the general public, given the shortage was exacerbated during the pandemic, that may seem slightly counterintuitive. And I thought I might give you an opportunity to talk a little bit about that and measures that you identify in your written testimony to try to alleviate that problem moving forward.
Thank you for your question, Congressman. Knowing that coming into the pandemic, we were approximately 60,000 truck drivers short in our industry, and projections are over the next decade, we will need an additional 1 million truck drivers just to keep up with what we want to do on each and every day to support the U.S. economy. We're very concerned with the introduction of new drivers and the workforce. Our workforce right now averages at least 6 to 7 years older than other industries' average age in the workforce. So it's concerning to us. We're going to have a lot of drivers who's retiring, getting out of the business, and we need that pipeline still to come in with new drivers. So we look forward to continuing working with FMCSA to promote this and workforce development through Congress and to get more truck drivers into the industry going forward. It's a good paying job. We average $56,000 as a truck driver plus benefits. This is a good paying job, and we look forward to getting the word out and getting more people into the industry.
You know, as we look forward, and let's make the assumption that life gets back to normal relatively soon, let's say in a year or so, and let's say 3 years from now, we have another pandemic hit. My question is, you know, what have we learned from this experience that we would apply to the practice field, so to speak, or the playing field, you know, the next time, God forbid, another pandemic hits? I'm curious what you might identify as things that are lessons learned that you would employ, you know, at a future time in a future pandemic if we were to have one.
Okay. You know, I think we've already discussed, you know, to keep the roadways open and keep facilities open for our truck drivers. I think we fully recognize the importance of our industry in getting goods to the final user, whether it be hospitals, whether it be grocery stores, or everything else in between. We now realize just how critical the trucking industry is to the overall economy and the health of our nation. So going forward, if another pandemic, God forbid, would happen again, you know, we want to learn from the lessons here, saying that we still need facilities, we still need to enable our truck drivers to get from point A to point B with critical goods.
I noted in your testimony you mentioned, you know, one problem folks generally had was delivering a load to one location, but then you're driving back with an empty truck because there was no freight available. Were there any innovative solutions that y'all were able to come up with to address those type of logistical issues?
Well, I certainly think the cooperation with FMCSA and the suspension on critical goods moved with hours of service helped our industry meet the needs, the immediate needs of the U.S. economy and what we were shipping at the time, whether it be health supplies or groceries or anything else. So that to me is the most important and critical part of what we've learned initially to keep the supply chain going. Yes, we have had issues, and yes, we are continuing having issues where we might be loaded one way and empty the next. But the hours of service and the ability for us to flex those. And mind you, we did not gain any additional hours for driving. No additional drive time was added in those relief hours of service. It was only to accommodate the rest time and so forth. So we feel it was critical for the agency to do what they did, and we very much appreciate them working with us on that topic.
Thank you, Mr. Chairman. I yield back.
Thank you. Representative Lowenthal.
Thank you, Mr. Chair. And I think this has been a great hearing. And I want to thank all the witnesses. And my first comment is more of a comment, and it's to Ms. Carr. You know, I flew before the pandemic every week and returned home every week from Southern California to Washington, D.C., and then back again. Just before, and once the pandemic began, I really did shelter at home and stay at home and followed all those guidelines because I'm a senior and I was real concerned about any kind of pre-existing condition I might have. As I returned to vote for the HEROES Act and remote voting, I felt like the airlines themselves did a great job. I thought the flight attendants were fine. I thought they really tried to protect the passengers. I engaged in wearing a mask, trying to keep a distance from others. But I had the worst experience in the airport. I just want to share. We had one long line to get on. There was no TSA really pre-check. And I understand some of the impacts towards TSA. But I was convinced nobody monitored whether people stayed 6 feet. There were markers, but nobody did that within the airport. And it was frightening. And it was even worse going back from Washington to Los Angeles when I got to the airport an hour and a half ahead of time before 6 a.m. And it was just terrible. There was one long line. Everybody was on the line. Half the people were not wearing masks at 6:30. It was a shock. And it was frightening to me. I was convinced, not so much being on the airplane, I was convinced that I had exposed myself. And so I just want to say it's going to take a long time for a person like me, and I would think others, to regain trust. And especially in the airports themselves. That's where I had a horrible time in airports in two areas that were both Washington and Los Angeles, which are very vulnerable because they're really high-risk areas. So I just wanted to say that, not to ask, that it's going to take a lot for me, and I would imagine for other passengers. It was a horrible experience being in the airport. The next question, though, that I have is from Mr. Byrd. As I went to Washington, as I worked on voting on the HEROES Act, which was designed to both protect frontline workers and to honor frontline workers, I was put in a very, very difficult position. I wanted to support, and I ultimately ended up supporting the HEROES Act. But as I got to Washington, was there, my local labor, the Western Conference of Teamsters, my local 952 of the Teamsters, strongly opposed in the HEROES Act, which was about COVID, the COVID-19, the inclusion of sweeping reforms to multi-employer pension plans. And they were joined by other labor from the West Coast. While at the same time, there was a tremendous amount of labor, and I understood where they were coming from too, such as the International Brotherhood of Teamsters, the carpenters, who saw the need right now for such reform. My question is, as we move forward, and there are the issues around composite plans, which my Western Conference is very concerned that it's going to sweep up and put their solvent defined benefit plans at risk. Shouldn't we be doing these through committee hearings and debate? I was just really felt put upon that it was put into the HEROES Act at the last moment. I want to ask your opinion of that.
Thank you for that question, Representative Blumenthal. I really wish that I could answer that question. I'm an occupational health and safety expert.
Yes.
And unfortunately, I have not been involved with any of our pension discussions, so I have no real position on that. I'm sorry.
I'm just saying it was very, very difficult for those of us that support, knowing that there should be some reforms, knowing that we were hearing from our own pension plan not to do it, and to have it put into a bill without having hearings on it. That was not designed to really do pension reform, but was put on. So I'm just sharing with you how difficult it was. And I was not alone. There were other people who were also wanted to be supportive of reform, but were put into a position that it was quite difficult to respond. And I ultimately ended up voting for the bill against my local labor unions. And it was very painful. It was very painful and very difficult to do. And I hope in the future that we take back that message that such important reform should be debated and discussed fully, not put in a COVID-19 bill. I also want to follow up on the question about, this would be, I think, to Mr. Willis, about the liability and immunity. I understand of employers. Yes.
Your time has expired.
Thank you, and I yield back.
Okay, thank you. Representative LaMalfa.
Thank you, Mr. Chairman. Glad to be on with you here. I was interested in the conversation a little bit earlier about, the liability limitation for those folks in transportation here. And so as we move through the legislation, I hear that's going to be happening with justice and policing, that we can extend the same courtesy for our officers in that they have a qualified immunity, and that doesn't get swept away from them as they're trained, as well as people are trained in the transportation sector. So with that, I had a question for Mr. Gilliatt on the issue with trucking, that as we know, with things starting to open up again, and we've had trucking that's been available to us, thankfully, to get all the supplies and groceries and everything we've needed through this crisis, that we've heard from truckers that their fleet's aging, that they need to replace their vehicles. The repair cost to older vehicles is tough, and they want to update anyway, have better running trucks. So it helps with them. It helps with automobile industry in general, those that produce, that we can get more of these trucks, the new trucks, on the highway. But as we know, the cost of a new truck has been prohibitive for a lot of owners and operators. $150,000 or more to buy a new truck, including the taxes. $22,000 of that is in federal taxes. So, Mr. Gilliatt, if you could speak to that a little, please. What kind of impact would that have for our transportation infrastructure to do what they need to do if we could suspend the federal excise taxes on heavy trucks, which indeed is around $20,000 on a new truck?
Congressman, thank you for your question. Yes, we've taken a poll amongst our members, and if we were successful in suspending the federal excise tax, which is an extreme burden on the new purchase of a truck, we've polled our membership. Approximately 60% of our membership said that they were either somewhat or very much more likely to purchase equipment during the suspension of the FET to purchase new equipment. Purchasing new equipment is better for the environment, better for safety, better for highways, and better for our suppliers. Our purchasing during the pandemic is down 70% year over year in purchasing during the onset of the COVID-19 event. So we'd like to get back to purchasing equipment again, and certainly the suspension of the FET would be a good way to incentivize the trucking industry to buy new and better equipment and get our manufacturers back to work again. Thank you.
Thank you. With again, nearly 8 million employed by the trucking industry, and we've had lower demand because of the shutdown with all the typical things that truckers would haul. You know, if you got it, a truck brought it. If you're not getting it, truck isn't bringing it. So you all have an estimation for the total economic damage to truckers just from this pandemic?
I don't have that statistic in front of me, sir. I'll be more than happy to get back with you on record from our association.
Well,
but I don't have those numbers in front of me.
If you rated it like we have the thermometers for fire danger in California, you know, you see along the highway it says low to high. What do you think it would be on your economic thermometer?
It's certainly high on our radar screen as far as the lack of activity since the onset of COVID. Again, certain segments of the industry have maintained a fairly steady pace, consumer type goods, although we are seeing some downfall in that in current weeks. But other segments of the industry has been really hit hard. The automotive sector, the fuel hauling sector, oil and gas sector has been hit extremely hard in the past few weeks.
Yeah, absolutely. So, well, it's been hell on truckers in my own state here in California with the CARB regulations and such. So it would certainly help those that think they can update what we're talking about again on the excise tax. If we can suspend that or even remove it. You know, that excise tax was put in place to help pay for World War I. So
yes,
you know,
I do.
Maybe we have it covered by now, you know.
So maybe we can take a look at it in a fully funded infrastructure bill, and maybe we can take a long-term look at that whole FET.
Yes, sir. Hey, thank you. Thank you, Mr. Chairman and committee members.
Thanks. Now we turn to Representative Lynch.
Hello, Mr. Chairman. Good to be with you. Nice job on this hearing. This was very helpful. At the top of the call, I heard the representative from the Teamsters, Mr. Lamont Bird, mention the Restoring Safeties in the Skies Act. We've been working with Ed Markey and with Senator Blumenthal on dropping a companion piece on Thursday. So it basically just creates a joint task force made up of all of the agencies, DOT and FAA and Customs and Border Patrol, TSA, but it also includes a lot of the unions to come up with best practices in light of what we've seen happen during this pandemic. So we are looking for original co-sponsors, and we welcome people from both sides of the aisle, obviously. My question is really on another matter that hasn't really been raised yet, and that is regarding maritime safety. So we have in my district, I represent the Port of Boston, so I've got the Seafarers Union, and I also have the Masters, Mates, and Pilots, and they serve in a capacity on these cargo ships that actually supply our folks in you know, at the 7th Fleet in Japan, the 5th Fleet in Bahrain. They service our folks in Afghanistan and Iraq. And because of the pandemic, many of them have been stranded on board their cargo ships during this pandemic because the host country, or the country that they're shipping to, has denied them access. Not only denied them access, but denied them access to airports or any type of travel. So they are trapped on their ships right now. And so I wanted to maybe ask Mr. Willis from the AFL-CIO. I know they've done great work on this. What are the initiatives that we're taking now to sort of free up our mariners? I've got a ton from my district. We've got Mass Maritime. We're a big supplier to that industry. And I'm just wondering what we can do for I know there's not a lot of folks. You know, I used to be counsel for the Teamsters, and I know, you know, we've got a million truckers out there, but these folks, I think, are being forgotten. And I'm just wondering if there's anything we can do to relieve their plight during this pandemic, and maybe take some lessons learned to adopt some provisions that might help them in the future. But Mr. Willis, if you could respond to that concern.
Sure, and thank you, Congressman Lynch, for your leadership on this issue. You know, it is just the strangest thing in the world. You have U.S. mariners on board, you know, ocean vessels funded under the Maritime Security Program, what is supposed to happen is that these U.S. crews are supposed to be rotated out about every 4 months when they get to a foreign port, and then we fly them out and obviously fly new crew in. But because of sort of overreactions, quite frankly, in some of these foreign countries, as you correctly point out, some of these ports are not allowing these crews to leave the vessels, and if they are, they have to stay in some type of quarantine, aren't able to access international airports. It is a prison, on the seas, quite frankly, that really needs to end. The maritime unions have come together on this issue. They've petitioned the State Department and others to figure out ways to get these U.S. mariners home. And I think raising this and pushing state and the White House to figure this out absolutely has to be a priority.
That's great. Mr. Chairman, just in closing, and I'll wrap it up, but I want members to know, so we got folks off the coast of China, we've got them off Sri Lanka, we've got them off the coast of Saudi Arabia, waiting to get into Bahrain. So we've got these folks all over the world, and as well as Southeast Asia, waiting to get into Japan and some other countries. So it would really be helpful to these families and to these individual mariners who are, real patriots in my eyes, but they're being left out there. And I just hope there's something we might be able to do in the future, maybe within Congress as well, to get together. I'd like the input of the Seafarers Union, the Masters, Mates, and Pilots on this, and the AFL-CIO, transportation trades, obviously, if we could get together here and try to come up with something good. But I really appreciate this hearing. You've done a great job with it, Mr. Chairman. I want to thank the ranking member as well, and I yield back. Thank you.
Thanks, Steve. Rep. Gonzalez, come on.
Thank you, Mr. Chairman. We are here back in DC, and I need to say that what Representative Lowenthal was explaining about his experiences while traveling is not different from any of us that have been traveling in the last 3 months. And actually, one of the main questions I got in the case of Puerto Rico, many of the visitors, of course, came by cruise ships or taking a plane. So what the government of Puerto Rico did in early March was upon arrival of all passengers, allowing them to have voluntary tests being done at the airport. Many of them that were with high temperatures, they were ordered to have a quarantine. But again, this is not mandatory. This is just voluntarily. But how about bringing or requiring? I'm not requesting this, but this is something that has been said locally on my island. I don't know if this is something that the industries or the unions are considering in terms of having a requirement for the passengers to have a certificate or a result of a test before going into a plane, while using all the masks and all the PPEs, but requesting or having a mandate to provide a certificate of clear test in terms of COVID-19. But today we're talking about COVID-19, but maybe in a few months it could be SARS, it could be any other situation. So we need to learn how to live with this kind of diseases. So how can we protect not just the employees of the airlines and the transportation industry, but the passengers as well? In that sense, my question will be, will you guys from the unions and the industry recommend that will be a requirement for travelers to be tested before, at their own expense, before departure, taking temperatures of those passengers before boarding to a plane? Ms. Carr?
Congresswoman, you raise an excellent point in that today it is COVID-19, but tomorrow it could be SARS or anything else. If passengers are sick or exhibiting symptoms, they need to stay home. That's the first thing we can do. The second thing we can do is ensure that we have all of these new regulations in place. We have a committee that comes together and creates federal mandates so that everyone knows When they travel, they're going to be health screened. When they travel, they're going to have to observe social distancing. This is going to require us as an industry to come together, as a travel group to come together, but it's going to require personal responsibility on the part of the passengers as well.
And I may, of course, we all need to agree that the passenger got a great responsibility as well. And we all know as well that airplanes, for good and bad, are like the petri dish, a flying petri dish bacteria of, and you can expose many of the passengers. But how we, knowing that some studies from Harvard University and many others talk about the incubation period through to be 3 or 4 to 14 days and symptoms in the 24 to 48 hours. And we can go to the detail of scientific information here. But my question will be, nobody will know if a passenger got it or not when they're boarding a plane. Same thing in a train, same thing in a ship. Now we're in the summer, so we're facing, for those living in the Caribbean, hurricane season, and that means that all this activity is going to, go again and again. Beside making tests, beside using the protective materials, what else in terms of the airlines should be done?
Congresswoman, again, I believe this is the reason that we need a task force in place to come up with strategies that not only apply for COVID-19, but would apply for any pandemic or health crisis moving forward. And it would be that task force that would determine all of these steps, whether that be testing, wearing masks, social distancing, how aircrafts are cleaned. All of that would be encompassed by this task force and would then be a federal mandate giving us what we need to do our job and keep everyone safe. It's not up to an airline to determine that. This is something our federal government needs to do.
Thank you. And I know my time expired, but I want to say thank you to all workers in the transportation industry.
Thanks, Jennifer. I have raised that issue. FAA claims they have no authority over health on airplanes, which is not true. They're trying to duck. So they say they have to get it from OSHA, and OSHA says they have to get it from CDC, and it's not forthcoming. With that, we would turn to Representative Carbajal.
Thank you, Mr. Chair, and thank you to all the individuals that are here testifying today. My question is directed at Mr. Shaw. Mr. Shaw, thank you for your time today and certainly your service as an essential worker, being on the front lines of this pandemic. As you mentioned in your testimony, COVID-19 has been horrendous for our country in terms of its impacts. In less than 6 months since the first individual or case confirmed, we've now had 110,000 people who have died. Extremely tragic. I know transportation workers like you and others throughout the country and in my district are essential, and you guys have been providing extraordinary service in terms of transit service to Americans everywhere. And this has come at a great health risk to you continuously by being exposed to the coronavirus. The HEROES Act that Congress passed last month provides hazard pay for workers. Why is this so essential in order to support people on the front lines? And two, in retrospect, do you think clear guidelines and earlier support from the administration and Department of Transportation could have been more helpful to transit agencies to better handle and address this crisis?
Thank you for the question, Congressman. Transit is an essential service. It needs the support from federal government in order to keep service going and our economy working. Better support from the federal government and oversight would have forced the companies to have the proper equipment to be able to enforce riders wearing masks. We have not received hazard pay in my company, our union has fought for it and has been constantly turned down. But again, without transit, the essential workers aren't getting around. They're not getting to the hospital. Nurses aren't getting to the hospitals. Police and firemen aren't getting to their districts. And better oversight or better force from the federal government to make the agencies enforce these rules would have definitely helped and made it a lot safer for us.
Thank you, Mr. Shaw. My next question is to Mr. Gallo. I know your industry has lost, it's my understanding, over 65,000 jobs. How soon do you feel that we will be able to recover those jobs in your industry once we get a little beyond the crisis that we have?
Our projections are going to be towards the end of 2021. Is the projections that we have right now based on the information that we're thinking happened with the economy. So about a year and a half before we get back to where we were at before, if everything goes okay.
And one question to all of you, if you could answer it briefly. If Congress could do one thing for your industry, what would that one thing be? If you only had one thing to advocate for, what would it be? And if we could start and go one to the other, to the other.
I'll start since I'm already on the microphone. As I've said already in my testimony, a fully funded infrastructure bill, bipartisan, would be the best thing Congress can do for this economy, best thing they can do for the safety and well-being of our workers in the industry. Thank you.
Thank you. Mr. Willis?
Well, I'll cheat and say they should pass the HEROES Act, amendment to make sure that we're covering other segments of transportation on the health and safety side. There's a lot of good provisions in there on hazard pay, on PPE requirements, on economic relief for transit and construction. So a good bill and a good start. And we know that this economy and transportation workers are going to need more immediate help here. So thank you.
Others quickly.
Mr. Byrd?
I would agree, passing the HEROES Act and having a strong federal health and safety regulation to deal with airborne infectious diseases.
Ms. Carr?
The extension of payroll support for workers.
And lastly, Mr. Shaw?
Hazard pay for all essential workers that are out there every day, continue to keep the economy growing.
Great.
Thank you very much, Mr. Chair. I yield back.
Thank you. Now, Representative Westerman.
Thank you, Mr. Chairman, and greetings from the front lines of Congress here in Washington, D.C. This is a very fitting topic that we're covering today. We've heard about the healthcare workers, the doctors, the nurses, the emergency medical services, our firemen and policemen who have been able or have not been able to work remotely during the pandemic, and we've all held them as heroes. But we've also got a lot of other frontline workers, and if nothing more, I would hope that they would realize from this hearing today and other actions that we do that they are appreciated and their jobs are extremely critical, and we couldn't survive without them. Ironically, one day apart last month, Peggy Noonan in the Wall Street Journal and Brett Stevens in the New York Times both published very similar opinion pieces on this topic of frontline workers, and their insights from those opinion pieces are very relevant to today's hearing. Peggy Noonan proposed that there is a class divide in our country that has become more apparent during the pandemic. She labeled the two classes as the protected and the unprotected. Noonan wrote that the protected make public policy, the unprotected live in it. And it's easy, as members of Congress, we're obviously in that protected class. Well, in the New York Times, Stevens furthered this argument as he opined and he exchanged Noonan's labels of protected and unprotected with remote and exposed. He cited a study that in America, only 1/3 of the population has the luxury of working remotely, while 2/3 must go to their jobs and face the risk of exposure. I just want to read briefly from his op-ed. He said, "For the remote, the lockdowns of the past 2 months have been stressful. For the exposed, they have been catastrophic. For the remote, another few weeks of lockdown is an irritant. For the exposed, whose jobs are disappearing by the millions every week, it is a terror. For the remote, COVID-19 is the grave new risk. For the exposed, it's one of several. For the remote, an image on the news of cars forming long lines at food banks is disconcerting. For the exposed, that image is, or may very soon be, the rear bumper in front of you. So I think it's very important that we recognize the job that these frontline workers in transportation are doing. And, you know, we saw shortages of things like toilet paper. We saw meat shortages. We know that we've got essential workers, like in my district, that are working in poultry processing plants, that are working in food distribution and transportation. But Mr. Gilliard and Mr. Byrd, could you take just a minute and describe what our country would look like in, say, just a couple of weeks if our frontline transportation workers in trucking decided not to go to work?
I would reference my oral presentation earlier. Grocery shelves would be empty. Pharmacies might not have the medicines that we need. The frontline medical physicians might not have the PPE that they need to perform their jobs properly. I think that's the easiest, most direct way we can say it, sir. And thank you for our recognition that we're getting in the trucking industry now. Thank you.
And I would like to echo those comments. And I would just add that, you know, I talked with a colleague several months ago and said, you know, today we have people fighting over rolls of toilet paper. If our supply chain shut down, it'll be absolute chaos. So I think that's what would happen in very short order if trucking were to shut down.
Yeah, we saw just with the shortage of a few things in the grocery stores that it was not looking good. But can you imagine without that transportation supply chain there in place, the interruption that it would be for everyone, not just the protected and the unprotected, but the remote as well as the exposed. One issue that I've talked to truckers about early on was they weren't able to get PPE. Is that situation eased any, or are they able to get PPE? And they also felt like people didn't think they were important, so the impression that I got from talking to them. Mr. Gilliard.
I think as we follow the guidelines from CDC and OSHA, early on, some of the PPE may not have even been recommended. But as it became known of how to protect our workers better, the initial purchase, the initial buys were difficult. It spoke earlier about the particular types of face masks that may be more safe or appropriate. The medical field has gotten those. So we as an industry, we buckled down. We've got face masks out to small and mid-sized carriers, larger motor carriers that might have been able to buy on scale because of their size and ability. Great. And then we also work with FMCSA and DOT. You know, millions of face masks given out to our industry. The hand sanitizer, we put out thousands of gallons there free of charge to our truck drivers. So I think that the ingenuity and the resilience of our industry came together. Companies working together, working with local officials to get this type of equipment out. And I think today's supplies, matter of fact, I'll even use my personal experience. Just today, I received 1,000 masks from FMCSA and DOT from my company. I'm already distributing them out. We already had company-sponsored face masks already, but we're putting more out to the industry, giving them out to whoever might need it in the transportation field. Thank you for your question.
Thank you.
Yield back.
Representative Brown.
Thank you, Mr. Chairman. First, I want to thank you, Mr. Chairman, for including so many transit worker safety provisions in the base text of the Invest in America Act. These include the National Transit Workforce Training Act of 2020 and the Public Transit Safety Program Improvement Act, which I was proud to introduce and had so many of our colleagues join me in that effort. I want to thank all of our panelists today for what they do on the front lines as transportation workers. I hope that they too recognize that the provisions that are in the INVEST Act would increase safety and training for transit workers across the nation. However, COVID-19 has created new safety challenges for the transportation sector. During this pandemic, frontline transit workers have had to put their lives at risk in order to keep our public transportation systems running for essential workers, and now for more and more Americans across the country as states begin their reopening process. Alarmingly, this risk to our frontline transportation workers is compounded by the lack of adequate mask, gloves, and additional PPE that is required for the job and that we've heard testimony about today. Additional social distancing must be taken to ensure that workers supports the infection. The work that you and your colleagues at the Transportation Trades Department have done to ensure that frontline workers are protected and have adequate PPE during this global pandemic. Additionally, your department has been a critical partner in working with me on the National Transit Workforce Training Act of 2020. This provision in the Invest in America Act will enhance training and educational programs for frontline employees, the local government-funded or aided public transportation systems. We began this effort before the COVID-19 pandemic because there were challenges facing the frontline workforce in the industry. However, ensuring that our frontline workers are trained and prepared to operate during the COVID-19 pandemic is critical, as highlighted by the testimony we've heard today. Mr. Willis, can you speak generally on the value of a federally mandated national training center for frontline workers and what it means to the workforce? And can you also speak more specifically on how having a national training center would have helped prepare frontline workers for the COVID-19 pandemic?
Larry?
Sorry. Thank you, Congressman, for that question and for your leadership on this issue. And thank the chairman of the committee for, yes, addressing this issue in the reauthorization bill that was recently put out. Look, we know that even before COVID, that we were facing in transit significant training and retention challenges for agencies across the country. The average age of a transit worker in key occupations is 52. So we know a lot of retirements are right around the corner. Put another way, within the next 10 years, we know the industry is going to have to either retrain or rehire up to 120% of its current workforce just to keep up with demand. And that doesn't even get into the technology issues that our members need to be trained on when we move to battery electric buses and other technology comes down the pipe. I think COVID-19 reminds us again about how important joint labor management training could have been and can still be, quite frankly. Bringing those entities in the same room together, figuring out what the best practices are across locations, figuring out how to disseminate information on how this threat has been evolving. I think a joint training center could serve that purpose. We've talked a lot on this hearing here today about masks and about N95 masks specifically. But we know that if you aren't trained on how to use those, if you aren't fitted correctly, quite frankly, they can do more harm than good because they give you a false sense of security. So a training center like you proposed could be a venue and an opportunity to make sure that workers are using the PPE correctly, making sure that disinfection procedures are being done in the right way. So very important issue no matter what. Again, I think COVID-19 reminds us that good transit training is essential here. So thank you.
Thank you. Mr. Chairman, I yield back.
Thanks, Anthony. We move now to Representative Fitzpatrick. Representative Fitzpatrick, unmute. Perhaps he had to leave. Then we would go to Representative Miller.
Thank you, Mr. Chairman, and thank all of you all for participating in today's discussion. and thank you for all the work that you are doing. During these times, it is encouraging to see different industries actually working together on behalf of the American people. Like many states in America, West Virginia has seen significant reduction in travel towards the beginning of the pandemic. Due to CARES and the reopening of our state, a lot of our stakeholders are feeling positive about end-of-year outlook. With that being said, protecting our workers as well as ensuring that our goods and services are delivered still must be a high priority. Mr. Guyot, can you discuss how reduction of service will affect supply chain in rural areas?
Just in general, the reduction in supplies, goods, and services going into the rural areas would be just as affected as it might be in a more populated area. So I don't have any information that would say specifically a rural area versus one that is more populated. But overall, the reduction in workforce and the reduction in supply chain and the continuity that we had going on before affects us all.
That is correct. And it's good to hear that it won't affect rural areas, obviously, since I live in a rural area. You mentioned protective equipment for drivers. I have had several truckers in West Virginia reach out on the topic of limited access to protective equipment and testing. Will ATA's focus on PPEs and testing continue as we continue to reopen across the country?
Yes, ma'am, it will. We're proud of the track record that we have already, getting a face mask into our small and mid-size motor carriers. We're proud of the fact of putting hand sanitizer at strategic locations across the country, and we will continue doing these type of activities supporting our workforce.
Well, what would be your advice for those essential workers that don't have current access to protective equipment?
I would say work with your employers. I know myself, I'm a small motor carrier, and we have gone out and sought additional supplies for our workers to make sure that they were safe during their work activity. We also have DOT and FMCSA putting out millions of face masks. They're out there available. Certainly they can contact our association so we can help get those out to the frontline workers as we have been already. So I would strongly recommend for workers to get with their employers to get the proper equipment.
That's good. In terms of goals for the future, what step is ATA taking to ensure that if this ever happens again, that we can continue to deliver goods and services across the U.S. with minimal impact to industry and supply chains? In other words, what would you do differently or the same?
I would say two things. First and foremost, we work with federal agencies as well as state and local agencies, government entities, to make sure that we kept the flow of trucks moving, proper restroom facilities, proper fueling stations, proper places to eat. So I would think that would be number one on our list. But certainly our biggest message to this Congress, this committee, is to fully fund a bipartisan infrastructure bill. The safety of our workers, the efficiency of our workers going forward relies on how well we fund infrastructure and get something moving on it. It's a long time needed. We all know it. We need to find a way. Congress needs to find a way to get this thing done and get it done now. Thank you.
Thank you so much, and I yield back my time.
Okay, thanks, Carol. Representative Esplat. Okay. Representative Malinowski. Right. Representative Stanton.
Mr. Chairman?
Yep.
Did you agree? Mr. Chairman?
You're up.
Can you hear me?
Yep.
Mr. Chairman?
Go ahead. I can hear you.
All right. Thank you very much. Thank you, Mr. Chairman, for holding this hearing. The COVID pandemic has impacted every sector of our economy and upended the transportation sector unlike anything that we have ever seen. Some Since day one of this crisis, our transportation workers have been on the front lines. They have kept critical goods and freight moving across the country, helped get people into their communities to critical services and their jobs, and made sure planes continue to operate and make sure that, and have made sure that infrastructure projects keep advancing across America. My first set of questions for Mr. Willis. Throughout this crisis, it has been important to mitigate against the spread of the virus within the workforce, minimizing exposure while workers are performing their duties, and ensure sufficient staffing. As efforts continue to reopen states and communities across the country, are transit agencies taking the steps necessary to ensure the health and safety of our frontline workers? And if not, what more should be done?
Well, I think some agencies are doing better than others, as we discussed today. Quite frankly, they're only doing it because workers have agitated, their unions have agitated to hold their feet to the fire, and the sort of the hodgepodge approach here really can't be sustained. We talked a lot today about how important frontline transportation workers are. Could not agree more. And if we really believe that here, then I think we have to be laser focused on the safety, what it is that we need to make them safer. And that is real enforceable standards, many of which were included in the HEROES legislation, to make sure that employers are complying, from CDC guidelines, and that they're enforceable and that they're actually occurring. Getting masks out to frontline workers is great, and we're supportive of that. But if there are not real federal mandates to make sure that employers are doing the right thing here in protecting workers, then we're not doing enough. So I think your comments on how important this workforce is, how important the transit workforce is, are really important. And if we believe that, then let's give them the federal mandates that we know are needed here. Because absent that, too many of these things are going to fall through the cracks.
Thank you for the answer. And on the issue of when a worker tests positive for COVID-19, what steps are now being taken to trace contact with other exposed individuals?
Yeah, that's a big issue. Testing absolutely has to be a part of any sort of return, opening up the economy. We don't think, quite frankly, that CDC is doing enough on contract tracing, thinking about the workplace as a place to plug in, to track, what happens when a worker does test positive, using unions on the ground to help with that, I think is essential. So that's a big missing piece here. That and testing, they go hand in hand. That's going to be crucial if we're going to, again, open up more segments of our economy in our country.
Thanks for the answer. Next question is for Mr. Shaw. What assistance has your employer provided employees who unfortunately have contracted COVID-19 or those that have been exposed to COVID-19?
Thank you for the question, Congressman. The assistance that my employer has provided is basically the federal FMLA, Family First COVID. They've put them out of work and given them the 40 hours. That's about it.
All right, thank you for that. I guess unfortunate answer, but I appreciate the answer itself. Ms. Carr, United, unlike other major airlines, requires passengers to wear masks. How has this policy worked across the company's fleet, and are passengers generally adhering to the directive?
So as you said, this is a company policy, Congressman, which unfortunately means that we don't have the federal backing to support this on the aircraft. If a passenger takes it off, the most that I can do is to ask them to put it back on. We need federal guidelines. We need a federal mandate that states you must wear this on board the aircraft with the exception of taking a brief moment to have something to eat or drink. We have to do this to ensure that the spread does not happen on board our aircrafts.
Okay, I really appreciate your advice in that regard. It is well taken, and I and the other members of the committee are listening. Thank you very much. I yield back, Mr. Chairman.
Thank you, Congressman.
Okay. Thanks, Greg. We actually did in the HEROES Act mandate masks, given the reluctance of the FAA to act, to force them to act. But it also, should a flight attendant order someone to put their mask back on, they disobey, that is a criminal offense. Unfortunately, I think the airlines are advising their flight attendants first. It might cause a conflict. Secondly, they don't want to criminally prosecute them, their passengers, as opposed to if we had a federal mandate, this would all be way better. With that, we would turn to Representative Fitzpatrick. I asked before and I was told he came back. I guess not. Okay, Representative Balderson.
Mr. Chairman, thank you very much. Panel, thank you for being here this afternoon and taking time to speak to us. And I want to also thank your companies and your organizations for your heroic work that has ensured our constituents have been able to travel and access food, medicine, PPE, and other necessities throughout this pandemic. My first question is for Mr. Randy Galet. Mr. Galet, on March 13, 2020, the administration, the Department of Transportation, and the Federal Motor Carrier Safety Administration took immediate action, issuing an emergency declaration to waive the hours of service regulations for motor carriers transporting essential supplies and equipment. This declaration ensured that my constituents had access to life-saving medicine, personal protection equipment, and food available at their local grocery stores. In May, the exemptions from hours of service rules were extended through June 14, 2020. Can you touch on the importance of these early actions?
Yes, sir. Thank you for your question. It was extremely important to have FMCSA and DOT work with the trucking industry to meet the needs of the shipping public. We had critical goods being delivered. Please keep in mind that these exemptions were for transportation only of those critical goods. And they also did not increase the number of hours available for a driver to drive his vehicle. It only increased the flexibility of his non-driving time. So we very much appreciate the flexibility. It met the needs of the industry and met the needs of the U.S. economy, allowing us to do our job. Thank you.
Thank you. My follow-up to that would be, do you believe the trucking industry would benefit if these exemptions were further extended?
I think they were extremely useful then and probably will be in the near term for critical goods. So yes, I would think we would, it deserves consideration from the agency to do so. Yes.
Thank you. I will stick with you. And in your testimony, you note the trucking industry faces a shortage of more than 60,000 qualified drivers, and you will need to hire 1.1 million new drivers over the next decade. I agree this is a major concern Congress needs to address, and I'm a proud co-sponsor of the Drive Safe Act, which would establish an apprenticeship program to train qualified 18 to 20-year-old CDL holders to safely operate in interstate commerce. I also understand the pandemic has increased delays for CDL testing, and there is a sizable backlog of testing appointments right now. Can you further discuss how the coronavirus pandemic has impacted the future workforce of the trucking industry?
Yes, thank you for co-sponsoring that bill. You know, we have long since recognized the need in our industry to bring younger drivers younger qualified drivers, additional safety equipment on trucks to help them become the safest driver as possible that they can be. We've lost as an industry, in a lot of cases, those young folks coming out of high school that may not be going to college, that may be going into another type of industry. So we very much want to improve upon that and get those young folks interested in our truck driving jobs. It supports a good family living, and thank you for that exposure, and thank you for that co-sponsorship there.
Thank you. As the economy improves, do you expect the trucking industry will be able to meet the demand of our economy this summer?
I suspect that we should be able to. Obviously, we are affected. Many different segments of our industry are laying off drivers. But yes, I do believe the resilience of the trucking industry is there, and that we should be able to meet the needs and demands of the U.S. economy going forward.
Anything else Congress could do to help to get back to normalcy?
Pass the highway bill. I think I've been pretty consistent with that all day long.
Yes, you have been. Okay. You have.
Fund infrastructure, please.
Appreciate your answer. And I thank you again for your time. And Mr. Chairman, I yield back.
Thank you.
I understand that Rep. Malinowski had trouble unmuting, and he is with us. Don? Oh, it's a note I got. Okay. Maybe he's having trouble again. Then we'd go to Representative Mucarsel Powell.
Thank you so much, Mr. Chairman. And I want to start by saying thank you to Ms. Carr, to Mr. Shah, for putting yourselves on the line and continuing to come to work. I know that you have a lot of anxiety, and as we've seen, COVID is a very contagious disease. So thank you so much for all the work to support our country moving forward. We've heard from medical professionals that wearing cloth masks or face coverings protects others around you more than it protects yourself. And that's why it's so important to have a face covering when you're around other people. For transit workers doing the essential and thankless job of providing this critical transportation service, not just to passengers, but other essential workers, and face coverings are not enough. And it doesn't provide them with enough protection. I know that our frontline transportation workers have asked for PPE. I was surprised to see that on May 28th, the U.S. Department of Transportation announced that they would be providing 5 million cloth face masks for public transit workers. This is May 28th. This is 2 months, more than 2 months after we all knew that COVID-19 was sweeping our country. At this moment, we had already crossed that terrible line of losing more than 100,000 lives because of COVID-19. And the Department of Transportation announced that it was going to provide cloth coverings, not proper PPE equipment. We're hearing it today, and I've heard it several times from our local transit workers in my district here in Miami-Dade County. They have asked for proper PPE. And I was very fortunate to have worked closely with a nonprofit here in my district where we were able to actually provide 2,800 KN95 masks to transit workers in Miami-Dade because they were not getting the equipment. We have about 7 million riders in Miami-Dade County every month. So you can imagine what they're exposing themselves to. So my first question, Mr. Willis, we took action right away. In the CARES Act, we passed significant funding for transit, for the Department of Transportation to provide necessary equipment for their transit workers. And in the House, we just passed the HEROES Act, which includes an additional $15 billion for transit agencies to improve worker safety, passenger health, and the entire system. The Senate has yet to vote on this bill. Can you speak to what this additional funding would mean for the health and the safety of our transit workers? Mr. Willis.
Yeah, it's absolutely critical because not only would that money go to health, and we talked about this earlier with fare box revenue that is lost and local taxpayer loss, but making sure that agencies are able to secure the right PPE for their frontline workers. So it is absolutely critical. The mask issue that you raised is a good one. We know that transit workers in close contact with passengers every day, with their coworkers every day, do need the type of respiratory protection an N95 mask or something similar would provide. The cloth mask, while better than nothing, doesn't really provide them, we think, the level of protections that are needed. Quite frankly, I think this administration could and should have done a much better and earlier job of coordinating efforts here, of using the Defense Production Act and other tools at its disposal to make sure that we are manufacturing and securing the level of respiratory protections that we know are needed for transit workers. N95s are not readily available. They're not always being used in the right way, quite frankly. By their very nature, they're supposed to be disposable, but people are using them over and over again. So really making sure that we're thinking about getting masks in the right way, and the right ones to transit workers, and other frontline transportation employees is critical here. And I think the CARES Act, the HEROES Act will definitely help, but I think the additional requirements that we've talked about here are also necessary. So thank you.
Thank you, Mr. Willis. Have you gotten any guidance from the Department of Transportation or HHS or any other federal agency for transit agencies, how you best need to protect workers and passengers? Have you gotten that guidance?
You know, they've put out a lot of guidance here. The problem is it's not mandatory. You know, guidance is one thing, but you need real, rules that are in place that are enforceable and they're going to hold employers accountable. That's the missing link here, and I think that's what Congress did to a very large degree in the HEROES Act. Again, I think that can be expanded to make sure we're covering broader sections of transportation. But that's what we really need here to make sure that employers are doing what they need to in the transportation space.
Okay,
Thank you so much.
Your time is expired. Thank you. Someone is not muted. Getting some ghosts in the air, so please check that you're muted. Now turn to Representative Fitzpatrick.
Thank you, Mr. Chairman, and thank you to all of our panelists for joining us. We very much appreciate it. My first question is for Mr. Shaw. First of all, thank you, Mr. Shaw, for your service to our country, not just abroad, but also fighting in the front lines of this pandemic right now. And as you know very well, our frontline workers, transit agencies such as SEPTA, have been tragically hit by this pandemic by paying the ultimate price, their lives. And yet you continue to show up to work every day, day in and day out, because you have families to feed, and also because you want to do your part and keep our country moving. So I also want to thank the TWU and the Local 234 in my backyard here in Philadelphia for all that the union has done to keep workers safe at SEPTA. And I know you've been a part of that fight as well. The union asked for and won additional worker protections, more PPE, and better cleaning procedures meant to keep us all safe. So my question, Mr. Shaw, is there any additional steps that SEPTA you think should be taking in response to this pandemic that have not yet been implemented?
Thank you for your question. We did gain some health protections, but a lot of it was, in my opinion, lip service. Sanitation of the buses, cleaning the buses and the system, not just the buses, but the trains and the platforms is not being done to CDC standards. They're not. We've moved back to front door operations and collecting fares. And now we've lost the sanitation runs where there were drivers that would opt to take these runs and clean and wipe down. We need more sanitation. We need better filtration on the buses, in the trains. So the concessions, they didn't concede. They just basically, to my opinion, did lip service. We've lost stuff. We've lost safety procedures now that we've gone back to collecting fares and going back to the front doors. We need more oversight to force the authority to sanitize these buses, trains, and platforms.
Okay.
Thanks, Tom. What can we be doing to help with that?
We could implement the sanitation runs again. We can bring them back and then enforce that the sanitation runs are filled and that they're there, especially as you get later into the night. There was no late shifts, but enforcement of the runs and having the people out there sanitizing.
Got it. Thanks, Tom. And thank you so much for your service. You guys are warriors, and we really appreciate you and the union and all you do to keep us safe, including my constituents in Bucks and Montgomery counties. So thank you, Tom. My second question, and final question, is for Larry Willis, president of TTD. So Larry, Congressman Malinowski and I, along with about 150 of our colleagues, sent a letter to the FTA administrator in April, urging updated guidelines on an increase in PPE allocations for transit workers. So I was wondering, Larry, if you could just share with us what more FTA and we at the federal level could be doing to support the transit workers that you represent.
Well, thank you, Congressman, not only for the question, the leadership you played on that letter and so many other issues. You're a good friend and we appreciate what you're doing there. I think what Tom said about what's going on in his agency, unfortunately, we're seeing across the country. I think if you talk to other locals at TWU, ATU, SMART, the other unions that represent transit workers, they would tell you similar stories. So I think getting in front of FTA to make sure again that they are requiring these agencies to actually abide by what CDC is saying is what we need to do. It's why the legislative solutions that we've talked about here and that are included in the hearings legislation have to be a part of that discussion as well. We just can't leave it up to individual transit agencies to decide when and how they're going to protect workers. Rear door boarding was the right idea to try to create some social distancing. Granted, they lost some revenue on that, but we can think creatively about how to both collect revenue and make sure that these drivers and passengers are protected to the greatest degree that we can. So we need to do better on that front. So again, thank you for what you've done here.
Thanks, Larry, and thank you, Tom. Both of you, thank you for your service, and we have your back on this committee. We appreciate the work you do. Mr. Chairman, I yield back.
Okay, thank you. Representative Finkenauer. Representative Garcia.
Thank you, Mr. Chairman and Ranking Member, for this very important hearing. The COVID-19 pandemic has affected us all, and those in my Chicago district particularly hard. Many have lost jobs and have experienced some of the highest infection rates in the state of Illinois. In Chicago, like the rest of the country, Black and Brown communities make up a disproportionate number of frontline workers who bear the brunt of this deadly virus. I asked for unanimous consent to enter 3 articles into the record from the New York Times, the Chicago Tribune, and the Los Angeles Times that demonstrate the disproportionate impact COVID has had on communities of color, including an article entitled "The Price of Being Essential. Latino service workers bear the brunt of the coronavirus." And as we're discussing today, if there's no objection. Thank you, Mr. Chairman. And as we're discussing, frontline workers include our transportation workers. They both provide an essential service and also get other essential workers to their jobs in urban areas, and especially for those in the northwest and southwest sides of Chicago, working class neighborhoods. Many healthcare workers, grocery store workers, and janitors rely on bus and transit operators to get to their jobs. They do this every day, even while risking their health and their family's health in the process. They deserve our thanks, but far more than that, they deserve our protections. These workers are essential and not expendable. That's why the CARES Act provided some help, but didn't go far enough. In contrast, HEROES Act would help further by extending airline worker pay protection, adding PPE requirements, and making more workers eligible for hazard pay. It would also help provide much needed funding to state and local governments, as we all know. Question for Mr. Willis. Your written testimony mentioned the importance of state revenues in maintaining our transportation infrastructure. What impact would you anticipate in the state and local governments if state and local governments don't receive more financial support during this crisis?
Well, thank you, Congressman. I believe that state aid that was included in the HEROES Act is absolutely essential to stabilizing the economy and to financially protecting so many workers that we rely on those state and local governments for their employment and the services they provide to our fellow citizens. So that has got to be part of any relief package that Congress considers. On the transportation side, we've already talked about it here. We know that state DOTs have seen a fall off in revenue for both highways and transit. I think that is having an immediate impact. We know if you look at the employment levels in April, for construction on the highway and roadside. It was the biggest single month drop, even though construction overall did a little bit better. If you go back and look at April, that is the biggest drop in employment levels that they've ever seen in the BLS. For that workforce since they started collecting data in 1990. And I think a lot of that goes to the state and local revenue problem that you raised. So I think overall, states need this assistance. I think it is also critical to the transit agencies and to the state highway and transportation authorities that rely on these funds as well. So again, thank you for the question and an absolutely critical issue for us in the labor movement.
Great, thank you, Mr. Willis. Mr. Byrd, in your testimony, you mentioned that there are safety implications to working under suspended hours of service regulations. And what can Congress do to ensure that we are prioritizing driver safety while also supporting the supply chain?
Thank you for the question. What can we do? I think that, during this crisis, it's certainly understandable that there were suspended hours of service regulations. What our concern is that while there are suspended hours of service regulations for those drivers who are responding to the COVID crisis, there was rulemaking done that further, in our opinion, weakened the safety standards for short haul drivers. I think it's just important that we are mindful that, that truck drivers, there are a limited number of hours that they can safely operate. And we just would like to see no further degrading of the safety standards while we're in the midst of this pandemic.
Okay, thank you. Thank you.
Thank you very much, Mr. Chairman. Yield back.
Yep, thank you. Representative Cohen. Steve? Unmute, Steve? Okay, must have had to go. All right. Sam, I see you're still with us. Do you have any closing remarks?
Did I get it off mute? I don't. I think it's been a good hearing. I think that, a lot of good information.
Okay, great. Thank you. I think the experiment worked. I was skeptical, and we did have a little initial problem with the mixed use, but I think it worked out well, and I think it bodes well for the future. So thanks everybody for participating, hanging in. Thanks to our witnesses, 3.5 hours. That's a long time. I appreciate that, and we will hope to act on some of the suggestions received here today. With that, let's see if I have to find my proper closing script. I don't know. Can I just adjourn the hearing? I think so. Is there anything I have to say? Oh, the record remains open for, I have so many pieces of paper, I'll never find it, for so many days. And with that, the hearing is adjourned.
Thank you, Mr. Chairman.
Okay, thanks.
Thank you, Mr. Chairman, and thank you, everyone.